Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio.
We are still spilling the tea.
And committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. Getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman,
Live, direct.
it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
Good morning, Cayman. Happy Monday. Having a little bit of a glitch with the radio today, so trying to figure out what's going on. Looks like the radio forgot me. What a hot mess. How is everybody doing this beautiful Monday morning? Yes, honey child, it's my birthday, and we're going to party like it's 1973. I have no clue what that would have been like, but I suspect wilder than I can imagine. I'm here for it. Thank you guys so much for all of the amazing birthday greetings. Really, really appreciate it. We got so much to talk about this morning. I have a lot to share. Lots of updates. Of course, I had surgery since I saw you guys last. So I got to tell you all about that. And of course, the news never ends. So there has been a lot happening in the community as well. So we got to get caught up on a little bit of sus here, there, and everywhere. So thank you for all the amazing birthday greetings. They have been flowing like flowetry. Lots of people reaching out. And what can I say except I appreciate it. You guys are amazing. Thank you so much. I'm trying to find an email. Let me see here now. Trying to see if I can help figure out what the issue is. With the radio this morning. I've restarted my little box. Okay. All right. I'm going to send this to some of the tech people on the other end to see if they are aware. Maybe they can help. That's the thing in life. You got to be prepared to ask for help. You'll never know. So, the last we spoke was on Wednesday after the show, or Wednesday show. And we had, I told you guys I was going to be doing knee surgery. Now, some of you were reaching out with all sorts of recommendations, and I appreciate it so much. Just telling him anything. We're on air now. Well, not really. Okay. So yes, ultimately, I did the surgery. And so I do want to talk about it because I think that, there are a number of you who've said to me, even on Wednesday's show, that that you have to have a procedure done and you're very, very apprehensive about it. So you're apprehensive about doing it. And so I think that sharing, what happened? Sharing our experiences. Yeah, and some tea, please. Sharing your experiences, I think, can be useful to each other. So I'm hoping that my experience can perhaps give you some insight. But you also have to know that there are different types of procedures, there are different types of patients. So I always want to have you keep that in the back of your mind in terms of the fact that everyone will have a different experience, right? So my experience may not be your experience. My body, is different than other bodies. And so those things do matter, even when it comes to medical procedures. So I can tell you what my experience was. And I hope that you can maybe glean something from that, again, knowing that every person will still have a very unique experience of their own. So let's wind it back a little bit. I have been having, well, I'll be honest with you. Some years ago, I actually tore the meniscus on my right knee, but it was in the back of the knee. So I didn't know a whole lot about meniscus tears until more recently. But apparently the meniscus is like this tissue that kind of cushions around. It envelops the entire knee in a way, right? So a tear in one area is not always the same. And it's not always treated the same as tears in other areas. So at the time that I had that one, and this was a number of years ago, I was told that basically, given the location of the tear, the best thing to do was to just leave it alone, because they said, that particular tear will repair itself on its own. So I said, okay. These people are the professionals. You listen to the professionals. So I said, right, no problem. So I listened to their advice, and it took a while, I'll admit, but eventually it did repair itself. And then, occasionally I would kind of have like knee pains, more so in the left knee than anything else. I would notice that when I would be playing like, pickleball or doing something a bit heavy on the walking. And then eventually, I'd come inside, I'd ice it, put my leg up, and it would go away. The pain would go away. When I play, I tend to brace it. So I wear one of the sleeves to give it a little bit more support. I went in over a year ago and I saw Dr. Naranjan about the knee pain, just to kind of see, like, what are we looking at? How serious is it? All these types of things. And so he basically said, yeah, we got to start working for sure on strengthening the knee, because this is really, really important. Because certain aspects of our body, certain joints, they require us to have muscle mass. It requires us to be, as strong as we possibly can, quite frankly, as it relates to just supporting that area. So the knee is one of those areas that takes a lot of, it takes a hit. So between the knee and the hips and even the feet and ankles, they support a lot of what we do. And so I'll be honest with you, that one of the other things that you have to understand is that, unfortunately, we, as we get older, tend to have weight on, and that doesn't help. So the excess weight is detrimental to all of our joints. Like, I saw something once that said something about one extra, like 5 extra pounds or 10 extra pounds on your body, which you might think is like nothing, is the equivalent of like a 50, 60, or 100-pound load on your knees, on your feet. And so that's like pretty significant when you think about it. Let me try to fix my straps here this morning. So, that's this dress. This bra has wide straps. My apologies. Yeah, there we go. It'll fall down again. So yes, it's a question of, trying to do the things that we know we need to do, keeping off the weight, exercising. Yes, Magdalene, we are having a radio issue. I've got somebody in the background trying to work on that. Hopefully. Okay, he's going to send me an email to connect. All right. I don't know what's going on. So he says it should connect me via another platform. I don't know what's happening this morning. A little tech issue here. So yes, so hopefully we can get that sorted here in just a second, Madeline. Yeah, so we have all of these things that we kind of have a sense of what we need to do. And if we're not doing them, and as we get older, there's certain things that work against us because we lose muscle mass. If you have any, the older that you get, you tend to be gaining more weight. And, the joints just have, hey, how old am I today? I got to do the math. I think I'm 52, 53. Somebody do the math for me. That's 52 or 53 years worth of usage on a joint. So things happen. So yeah, it's just one of those things. Click that on your main PC that gets the audio. Okay, let me see. So it'll, things happen. And as a result, we, allow while visiting this site. Yes. Okay. So as a result, do I need to do anything with headphones? Let me just have a look here. Use default system. I think that's okay. So yeah, as a result of all of these things compounded, sometimes things start to go. What I'm amazed at, though, is the fact that we have the access to medicine like we never have had before. And so that's a big deal because years gone by, people would suffer endlessly in pain for no reason. And when I say no reason, I mean there could have been a solution, but unfortunately, they, didn't have a medically viable solution, or it was too expensive. There were so many barriers to healthcare. And I know that barriers to healthcare still exist for some people, even in this day and age. And we always have to be very, very mindful of those because, not everybody has access to the same things that we do. And I think that that's one of the things. I was having conversations with people recently, and they were saying that here in Cayman, we have such an amazing healthcare system. Even with the things that we complain about and the issues that we have, we still, by and large, have an amazing healthcare system. We have so many things available to us. And so that was, that's important. We can live our lives now relatively pain-free. And I just want to say that for me, the takeaway here, folks, is I was living in pain really since May. And you don't have to live in pain. I mean, the pain was daily. It was, I actually need to take some pain meds this morning. So let me just have some eggs or something, please. It was excruciating. And it's funny how you can actually get used to pain. It's just one of those things where you kind of learn to ignore it, but it impacts like everything. So every time I go to stand up, I was feeling it. Even when I wasn't doing anything, I'm like trying to sleep at night. I wasn't getting the same quality of sleep because this right knee, which I started to feel the right knee when I was in Cayman Brac in May. I went to Cayman Brac in May and I hadn't been there in a number of years. And so where we stayed at the Dart property, we were upstairs, and just going up and down the stairs, I really started to feel the right knee hurt. And it was like obvious, And the thing that occurred to me is I know that when you have, and for years I felt like it was always something on the left. It was like the left ankle, the left knee, the left shoulder, the left elbow. Like my left knee, my left side seemed to have been really, really a lot weaker. And so after a while, that means that you start to do things differently. And so the stronger side, or the side that doesn't have constant pain, starts to compensate for the weak side. And so you do all kind of stuff, you'd be surprised. You're like leaning to one side. And, so sometimes when you go into the doctor, they're like, oh, I can tell you're having pain over here, although you're like leaning this way and you're all twisted and whatever. So the body finds a way to try to live with pain. And what I'm going to tell you guys is you don't actually have to live with pain. Take it from me. I've been doing it since May. And so I just want to say that there are options out there for you. And so I'm going to share just a little bit of my journey here today. Y'all know how to take videos and stuff. Because again, I want to educate people about what my experience was. And also hopefully just have people understand that if you are sitting here thinking about going to the doctor, doing something, by all means, definitely look into it. I remember well over a year ago, maybe even a year and a half ago, there was a lady who I saw one time when I went to Health City. And she said to me, hey, you're that Sandy lady from that show. And I said, yep. She said, I've been thinking about, I think hers was knee as well. Was hers knee or shoulder? Yeah, I think hers was knee or hip replacement or something. But she had been thinking about it for a while, and she saw or heard one of the shows where one of the physicians came in, and there's a younger lady who came on and talked about the fact that, I want to say it was hip. I don't think it was knees that time. But anyway, she had some orthopedic procedure, and she was talking about her procedure and how, she ended up having it done. And she said that after she heard that show, she just really got the courage to do it herself. She said, I was scared. And listen, there's absolutely nothing wrong with being afraid. Like, nobody wants to have these procedures, quite frankly, if you don't have to. And so I understand the fear factor. And there's some people who will say to me, they're more afraid of a thing, and then they do it and they're like, oh my God, what was I afraid of? And so some people think, well, you have no fear, like you just did it. And I think it's not really a question of not having any fear. In my head, and I'll tell you what sort of brought me to the conclusion of what I needed to do. So I've been dealing with this since May. Went on vacation, annual family trip in the summer. And I did not really enjoy my vacation as much as I could have because of this knee pain, right? So I did an MRI before I went away in July. The MRI results came back saying that there was basically nothing specific, just kind of wear and tear in the meniscus, but not a tear itself. And so I was like, okay. So the advice there is don't do anything. So listen, a lot of people are like, oh, surgeons just won't operate. And I said, well, that hasn't been my experience. I don't know what surgeons y'all go to, but honestly, the people that I've dealt with in particular at Health City, and by the way, this is my first, I'm just realizing this is my first surgery at Health City, right? So I can tell you all about my first experience. And so I have never found that they were like, oh, let's hurry up and get you into surgery right now. It's the advice that I have always had about every single thing that I go in there for, whether it's I've got degenerative thing going on in the neck. And then they're like, no, physio. They said, listen, we're catching the things now at your age. You do physio, you can strengthen the vertebrae in the neck. Dr. Naranjan sat there with me and showed me what exercises I need to do every single day. He's like, that will help to strengthen the vertebrae. So we either offset the possibility of surgery forever, hopefully, get another 30 years, that's going to be the end of the road probably, right? Or you delay it significantly so that you don't have to run in there and get surgery done. So my experience has been never anybody pushing me towards getting surgery at all. So when the MRI results came back in early July saying, kind of low grade something, but nothing specific, the doctor was like, The protocol treatment for this is physio. It's not surgical intervention. So I said, okay, all right. So, we'll start in that. But the pain that I was having was really, really constant. I mean, 24/7. It was intense. I feel like my blood pressure has been up literally because of this, right? So I went on vacation. I'm one of those people who I don't like to be in those little mobile carts if I don't have to. I had to rely on them to like get around this trip when I went to Legoland. That makes me feel like I'm 85 and not early 50s. That's just not my vibe. I'm like the person who hopefully when I'm 85, I'm still going to be, I'm not really a dancer, but I want to be kicking it up on the dance floor. I want to be traveling. I want to be seeing the world. I want to be like a vibrant 85. I don't want to be an 85 with a crutch and a this and a that. I'm like, no, that's not my vibe. And so I kind of felt away even about having to rely on these things that I had to during my trip. The first half of the trip, I was taking Voltaren, spoke to another doc, and I said, Doc, I need some painkillers. He's like, all right, I got some good stuff for you. Gave me the Voltaren. And I will tell you that the Voltaren helped with the pain. It doesn't mean that the pain isn't still there. It made me forget about the pain for the first week or whatever that I took it. And, you got to be careful. Like if you're living on pain meds, there's a lot of things that you need to be aware of about that because that's not healthy. They impact your heart, some worse than others. And masking the pain isn't really a solution, right? So I did it. As soon as I stopped, boom, the pain was back. Okay. So I come back to Cayman and I was like, okay, what am I going to do? So I reached out to these people. I'm just telling y'all my whole story here, my whole protocol. I reached out to the Regenix people because I said, you know what? I hear a lot of people. I saw somebody at the airport a few months ago, like, oh, go to Regenix. They do stem cell, this, that. I'm like, okay. So I went to them and I met with Dr. Williams, really nice guy. I really like him a lot. And he said to me, they do a clinical assessment. And he said to me, all right, let me have a look. So, they do kind of the same thing as an orthopedic surgeon. They like twisted this and that and whatever. That's your clinical assessment of what's going on. So then he said, let me have a look at it with my ultrasound machine. So he has a little ultrasound machine in his office. And he looked at, he's like, oh, honey chill. He didn't quite say that, but he's like, you have a meniscus tear. And I was like, what? How can I have a meniscus tear? He said, yep, you've got a meniscus tear. And I said, well, he said, somebody missed this on the initial MRI report. So go back to your orthopedic surgeon and talk to them about it. So I went back and Dr. Naranjan said, oh, no bueno. I don't know how they missed this because they actually don't have, FYI right now, they have someone coming, but they did not have an in-house radiologist. So they were having, someone do the scan and then they send the radiology report off for a company. That's what they do. They read these reports. So they missed the tear. Okay. That was a month that I could have been thinking about some solutions here, but they missed the tear. I spoke to the team at HSA about it. Dr. Benoit was not happy. Let me just say something about the team at HSA. This has been my observations, right? Nobody is perfect in terms of patient care. Trust me, things happen. People are human. Sometimes mistakes are made. Sometimes bedside manners need improvement. Things happen. The one thing that I must say I have noticed as an objective observer is when something is brought to the attention of the team at, somebody said that pickleball match with the premier is what messed up your knee. You gave it your all to beat him. I know, right? Kind of true. So yes, they are very, very quick to fix things. So when something comes to their attention, a complaint, they take it seriously and they're going to deal with it. So when I spoke to him about the fact that this was missed on my MRI report, especially in lieu of, because Dr. Naranjan was like, listen, in my clinical notes, after I did your assessment, I actually said, in all of his 20-something years of experience, I think she has a medial meniscus tear. I think is what it's called, right? He said that in his report. So he's expecting now the radiologist, after you do the MRI, for them to look very, very closely for a medial meniscal tear, because he's suspecting, as a physician with umpteen years of experience, that, hey, that's what she's got. And they missed it. Okay. So, Dr. Benoit said, we're going to, my apologies. Someone says, you said HSA twice. I think you meant HCCI. Let me be very clear. Health City, Cayman Islands. That's where Dr. Nanjan is, and that's where I went. The acronyms are very close. They should have chosen a different name, I think, but Health City, Cayman Islands. HCCI, that's what I'm talking about. So he said to me, he'll deal with it. Deal with it, meaning they've gotten rid of that particular company already. By the next day, he's like, we will not be using their services anymore. We can't have them missing stuff like this, right? I'm like, do what you got to do. Patient care first. So anywho, so now the advice is like, okay, we got to look at maybe some other options. So when I went to Regenix, the guy, Dr. Williams there, said, you know, what you have is not something that we would recommend stem cell treatment for. And stem cell treatment is very expensive. This is not something that's cheap. Insurance is if you have a better plan, they'll cover a percentage of it. But stem cell is not cheap. They do PRP, which is the plasma, where they draw blood and they take the plasma out of your blood. And the idea is the plasma goes into, they put it in the injection, like they put it in the site, and it supposedly helps to rejuvenate and help the body heal itself, right? So I decided to do some additional research. You know, I heard him said we can try the plasma treatment. You know, you have to wait so I was going to do that same day. I was going to do a steroid injection. If I did that, then I have to wait 6 weeks to do the plasma treatment. And then you have to wait. And it's a process of, you're still looking at months and months and months and months, right? When I did my research on PRP specific to meniscus tear, because it might work really well with other things, but specific to meniscus tear, the overall medical advice is that the research evidence doesn't really show that PRP is really effective for a meniscus tear, right? So it's not going to repair the tear. So it's called platelet-rich plasma, that's PRP therapy, is a potential treatment option for meniscus tears, which basically try to utilize the body's healing properties to reduce pain and improve function. So they go in there with a concentrated dose of platelets from the patient's own blood supply and inject it into the injured meniscus. So PRP therapy shows promise as an alternative or adjunct to surgery, particularly for degenerative tears, but its long-term effectiveness still being investigated. Now, there is a difference between the degenerative tear, there's different tear types, right? So this is where you're going to ask your physician questions. One thing I really, really like with Dr. Benoit, is every time I talk to him, he pulls out one of the knee parts or whatever. He does a phenomenal job at actually explaining what is going on. So, it basically, the recommendation is it's going to enhance healing if you're doing other things like surgery. So, listen, there's an orthopedicreviews.com where they've researched this. And so I'm not going to just go and sit down and listen to physicians. Sometimes I go away and I do a little bit of additional therapy. Do therapy too while you're at it. I go in and do a little bit of research. And so, in addition to what else you're doing, it's going to enhance the healing process. So I don't know yet. It helps athletes and stuff to return quickly, during the rehabilitation stage. So I may still do a little PRP. I don't know. But weekend before last, was Gigi's birthday. And so we treated her at the Indigo. Big shout out to the Indigo, by the way. First time really at the facility. I think I've been there once for a lunch, something or another. But really nice facility, great service, and the food is amazing. Just saying, rooms were great. They had a little birthday cake laid out for my little Gigi. She was so excited when she got in the room. She's like, oh my gosh, birthday cake. So I was there with her that weekend. And again, this is something that impedes like your quality of life. I woke up at 4 o'clock in the morning on Sunday. And I was in so much pain at 4 o'clock in the morning. I started messaging Dr. Benoit, Dr. Naranjan. He must have a very understanding wife. So here I am at 4 o'clock in the morning, messaging him saying, oh man, I can't take this pain anymore. Like I literally cannot take this pain anymore. This ain't normal. I'm like, oh, doc, I've just had enough. So he was like, okay, come and see me. We need to talk about it. Let's see what we're gonna do. So I said, all right. I just can't, right? I'm at 4:36 a.m. I said, good morning. I do think we're going to have to explore the surgery option. Sigh. I don't want to delay the inevitable. And how long after the injection can I do the surgery? Because I had done the steroid injection. That didn't really alleviate. And then he says, do we know what type of tear it is? I'm traveling in mid-September. I want to have a decent time when I travel. So he came back and he said, it could be a combination of a radial and horizontal tear. That's what it looks like to him. And I want to see the percentage of improvement with the injection. The higher the percentage of improvement, the lesser the role of the meniscus in the pain. It tells me that the cause of the pain is not just the meniscus, but also cartilage degeneration. Degeneration. Plus inflammation, which will not respond to the procedure. So he said, once we define the role of the meniscus in causing the pain, we can have a realistic goal and expectation. So anyway, he said, the procedure is a 10-minute minor one, 10 minutes for him, not 10 minutes for me, to be clear. It causes no harm, but it will not fix the cartilage issues, the pain arising from the degeneration will still persist and progress with the procedure. He's like, let's have a look. So I went, did all the pre-op stuff, surgery day. Here we go. I want to share some videos with you guys from surgery day. I'm going to post these up so that you can get a fuller idea of exactly what happened. Surgery day. Hold on. Do I have my, let me just plug in my, I want to show you guys some of this stuff. So anyway, I went in that morning. Originally, I was going to do a show the Thursday morning, and I said to myself, nah, I'm going to go straight into surgery first thing in the morning because I just wanted to kind of get it over with. And then I realized that although it's a day procedure, if I go later in the day, that means, I'm out later at night. And I was just like, nah, let me just go first thing in the morning, be his first patient, get it over with. So he said, fine. If I don't have any emergency clients, then yes, we can definitely fit you in. So we did that. Thank you so much, doc. So I got in there and did the procedure. First of all, let me say, they have a suite there at that hospital that is like, I was like, can I just move in? We can talk about the logistics of why I need to just live here. This is a huge suite. Let me see if I can find it. Let me see here now. Where did I put that? I have my videos and all this kind of stuff here. Dun, 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 dun. Hold on. So yeah, I was like, this suite is amazing. It's big. It's, you got one side with the bed and a sitting chair. And then you got the other side with, you can like sit down, watch TV. It's huge. It's a beautiful, absolutely beautiful suite. I was like, wow, mess with you guys. Anyway, did my pre-op stuff. Dr. Benoit came to check on me to say hello. And I said, okay, I think we're ready. We're gonna get this done. So they're like, okay, no problem. So we go in there and First of all, let me just say this as an aside. This is kind of a funny thing about me, but they always have a really challenging time finding my veins. Okay. Now, it means that I will never be an intravenous drug user. If somebody comes to you and say that, oh my God, Sandy's using heroin, you know that ain't true. You know that that's a lie, or somebody gave it to me or something. Because I do not have the capacity. It's just the most bizarre thing. But they can never find a vein in my arm. It is, it's challenging. Child, they be slapping my arm. They be doing the most. So the nurse had put one in on the right arm, and it was actually quite painful. And these are the nuances. I'm sharing this story because these are the nuances that, I think everybody should know about. But Dr. Benoit walked in, and as he was talking to me, he made the observation that I looked like I was in a little bit of discomfort with this insertion point in my arm. So he said to me, are you in pain? And I said, actually, now that you mention it, yeah, I am. So he said, okay. He informed the nurse to go ahead and take it out. And he said, have the guys at the anesthesiologist, have them deal with it. So I said, okay, no problem, doc. Whatever you say. So even when I went to anesthesiology, in the surgery room, they were like, oh, welcome. And I'm just like, hi. Honey, chill. Why can I not find? Hold on a second. I'm finding this on my iCloud drive. Okay, give me 1 second here. I'm trying to figure out where this file is. I think I'm actually sent it to the wrong place. So yeah, so they said, listen, you have veins that are a little bit challenging, but we're gonna find them, not to worry. And I said, okay, do your thing. And so yeah, they had to go into that one arm. They went into the other arm actually, because the left arm, they just couldn't find it. They're like, okay, we're gonna go in and do what we got to do. So they were slapping it and make the pump fisting and all this kind of stuff to try to find it. So I said, okay. Eventually they found a line and they said, all right, we're going to start administering some of the medication. You're going to start to feel drowsy. Some people, I don't know what the protocols are, but some people like count down and you go 9 or 10, count backwards and boom, you're out. Other people, like these guys, there's actually 3 of them. And so they were like, yeah, you're going to start to feel a little bit drowsy. And that's all I remember. He said, you're going to start to feel a little bit drowsy, and kaboom, I was out. I don't remember anything else. So I then woke up. You wake up in recovery. And the nurse was like, hey, I remember somebody saying to me that the surgery went well. I do remember Dr. Naranjan coming in and talking to me a little bit, but he said, I'll talk to you again later on. Because, of course, you're still a little bit groggy. I was like, I don't even know what you're talking about, doc. You're still under the drugs. And I was kind of wondering about this the other day. I'm like, wait a minute. They put you under, but how do they wake you up? Like, I've never really thought much about this. But I'm just like, how do they actually wake you up after the procedure? Do they give you other drugs? I was speaking to a nurse in the family, and she's like, yeah. They wake you up with other drugs. And I was like, wow. And then also the drugs have a life cycle. Like they have a certain amount of time that, depending on what they give you, what they administer you, are effective for, right? So anywho, I, started to come to a little bit. Didn't seem to have any real issues with that. I was just really tired. And then they were like, okay, we're going to, we'll take some time here in the recovery. We'll keep you here for a little while. We need to monitor you. Just make sure everything's okay. And then we will take you back to your room for your continued recovery. And then, maybe another hour or so, you'll be ready to be discharged. So I said, okay, no problem. And so that's what we did. Now, I got to tell you, I want to give a big shout out to nurses. I feel like nurses and the support staff in general are so underappreciated. Nurses are like, listen, you need the surgeons. They're amazing. They do an amazing job. But I think that nurses are a godsend. Like, they do the things that probably nobody else wants to do that has to get done. And I have had, when I had my C-section, I've had some other surgeries before in my life, and you can't get up initially to go to the bathroom. And so the nurses are there with you throughout this process. And a lot of times they are the ones who, have to make sure that, oh my gosh, I got to go to the bathroom. And they're like, okay, no problem. Let me get the pan. I'm like, oh, girl, I could not be a nurse. Thank you so much to all of the amazing nurses out there. Some of y'all ain't got no bed manners, but I must say, there was a shift change. So in the morning, one young lady was coming off, and then the other young lady was coming on. They were amazing. They were just absolutely amazing. So when I said to her, I'm so embarrassed because, listen, I don't want nobody helping me go to the bathroom. I got crutches right now. I don't want to be on crutches. I like my independence. And this is why I really knew that I had to have this procedure, because I'm not that kind of person that wants people like helping me get up and helping me go places. I'm like, no, honey, chill. Just let me go. Let me fly like a butterfly. Sting like a bee. Let me fix this thing here. So yes, there we go. So, when I had to go to the bathroom, I was like, ma'am, I'm so sorry, but I think I have to use the bathroom. She's like, it's no problem. She brings the bedpan. Of course, when I feel like I have to go, I don't really go. I'm just like, oh, sorry. She's like, no, it's okay. She says it happens after surgery. Your bladder feels full, but sometimes you're just not ready to go. So I'm like, oh, how embarrassing is that? Anyway, this is her. I'm going to show you my nurse. This was the young lady who was with me most of the time there. Really, really nice young lady. Big shout out to her. And this doctor here was part of the anesthesiologist, like part of that team. And so he came to check on me afterwards when I had left the recovery room and I was back in the room. They want to make sure that like you're eating and everything else is going okay. They want to make sure that you can keep food down before they're going to let you go and stuff like that. So they always feed you. And of course, the food at Shetty is like restaurant style food. So I was like, oh, yes, I'm here for that. So check out the room. Somebody was just saying, is this suite like normal? No, I think this is the VIP suite for sure. I mean, look at this. It's got like a whole living room inside of it. It was so spacious. But yeah, you can get it. I mean, you can obviously get the suite. Beautifully decorated. I need to talk to their decorators, for when we were doing our CMR studio. But look at this. Gorgeous. So if you have people there, like they can sit over and lounge in this area in the sofa. I don't know if that's a real TV or not. It's so like thin. I think it might be, but there was nothing. It was just looping stuff like. But I guess they could watch TV over on this side, and then the patient is over here. And then there's a whole other section with like a huge bathroom and stuff as well. So those of you who've not had the opportunity to visit the Camana Bay location, I mean, it's very, very modern, designed well, functional in so many different ways, right? So, even when I got there in the morning, the security guard was like, oh, miss, come this way because that other door doesn't open until a certain amount of time. And we don't want you to be waiting. So come through this door, Miss Sandy. I was like, oh my gosh, you guys are just on top of it. So couple little things. Listen to your PT, your physical therapist, because she knows what she's talking about. I'm going to give a big shout out to Melanie. She was actually in the show before, Kimanian young lady. I love when I go places and I see Kimanian faces in the mix. You know, we're such a, as they say, we're small, but how does the saying go? Small, but talawa, you know? So it's so amazing to see that we can be and we are being integrated in these facilities. And to wake up and have my physiotherapist be a Caymanian, to hear that Caymanian voice, I was like, oh, you're so pretty. I was like, I'm so happy to see you. So big shout out to Mel. This is her. I think she's actually been on the show before as well. She was like, yeah, I've been on your show, Miss Ann. I'm like, you have been? Shout, I'll be forgetting stuff. But really, really pleasant young lady. And so I'm going to share some of these. I'm not going to share them in their entirety this morning because I already see Johan complaining, but he wants to talk to us about something else. What is wrong with Johan? I got to kick him with my good knee. So here she is, like showing me some of the stuff that I want to do, that I needed to do right away, because until I can get into like the routine therapist, which I'll start later on this week. The thing about it, one of the biggest, and you know, big shout out again to Dr. Naranjan. Let me see which one of these videos is him talking to me pre-surgery. Yeah, I think it's this one.
Morning, and today we'll be.
This is him.
So
let me just, I think I need to turn the volume.
In brief, how it goes, what we'll be doing, and what are the possible risks, and you can ask me any questions in between if you have any doubts.
Yeah.
So the procedure includes, first step is to go inside the knee with 2 tiny holes. So
he went through, I'm gonna load these up online later, but he went through everything in terms of like what the procedure, what to expect. He also talked about the, you know, possibility of what can go wrong. So he's like, you know, they know what the risks are, less than 1% for this, less than 2% for this. So one risk that you have with any surgery is that there's a potential of a blood clot developing. And we've seen, unfortunately, even our own Caymanians have had knee surgeries and they had a blood clot and died. You know, this is a very real possibility. And so there are things that you can do to offset the likelihood of a person getting a blood clot. So if you're having a major surgery, like say you're doing 2 knee replacement surgeries, then definitely they'd be putting you on blood thinners. He said to me, because this is a keyhole surgery, it's a day procedure. It's not really considered that serious of a surgery. Like literally I'll be in there for just 10, 15 minutes or whatever. You know, we're not going to give you blood thinners because everything has a negative and side effect and whatever. So he said, we're not going to give you blood thinners for this. But then when the PT when Melanie comes in, Melanie's like, listen, we need to make sure, you know, wiggle your toes because I want to make sure you can move your toes, move your ankle. And you constantly have to be doing as much as you can, a couple times a day. Although day 1 and 2 is always the roughest days, you're going to have to be moving as much as you can, put a little bit of weight on it. With this surgery, you can as much as you're comfortable. You know, so she showed me some exercises to do. She then sent it on the email. So I had the available link. And she's like, yeah, we need to make sure that you're doing these things because you don't want to develop a blood clot. And the clotting happens when there's no movement, when you're not moving enough and you're kind of way too sedentary, which, you know, you're going to be more sedentary than normal. So even though I'm sitting here right now, honey chan, I'm already twisting those ankles, doing my little vibrating, my up and down. And so it's important because that's always a risk with surgery. So then there's a risk of possible infection. So he talked about that and, you know, what they do in terms of that. So he went through, you know, like I said, I'll share it in greater detail. I'll put the videos together, but he went through all of that when he came back in. All right. So we're here with Dr. Naranjan doing a little post-op same day, a few hours later, really. Yeah. Doing a bit of a post-op summary before I am discharged. So tell me your findings, please.
Okay, so we picked up one finding which was as expected. So your medial meniscus injury, which was a radial tear, that it was as expected. So we smoothened it out. Good thing.
So he even told me like beforehand with a tear, depending on the location. And like, he's very, very good at explaining, I must tell you. He's got the patience of Job. But he said that depending on the tear and the location and so forth, sometimes they'll stitch a tear and then other times they just have to smooth it because, they can't stitch it because of the location. So he explained all of that beforehand. So in this instance, he said when they went in, they saw exactly where the tear was and everything. The smoothing procedure was the one that they went with.
Thing is, it was not more than what we expected, so you did not need any additional procedure in that area.
Right.
But on the other hand, your cartilage was more damaged than what we had expected to begin with. So it was like fluffy and it was not smooth. So what we did is we used the radio frequency ablator to kind of stabilize and make it smooth. I'll share you the videos. Once you see that, you will understand how bad it was before and how smooth it became later.
Oh, wow. So here's the thing. He said sometimes all the best equipment, the MRI, the this and that, they can only show you so much. When you go in there, then you see what's really going on. So they went in there. He found the meniscus tear as they expected. But what he didn't expect was to find the cartilage damage as progressed as it was. So he explained to me the stages of cartilage damage. I think he does that next. Let's see.
Even the meniscus is stable. So rest of your knee joint is good. So we have not used any stitches. It's just a skin glue. So you don't need any stitch removal. But yeah, once or twice we will do the dressing just to make sure that there is no infection. Once you go home, you can walk with the help of either the crutches, either one crutch or two crutch, depending on your pain. You can bend and straighten your leg. It's difficult for a day because it's we have put a compression bandage. But once the dressing is done, I've called to come back again after 2 days. That's on Saturday. That is when we make it into a simpler dressing. After that, you will be able to bend your knee.
Okay.
So I expect good improvement with respect to the pain. But I also expect some commitment in the long term to protect your cartilage in terms of lifestyle management changes and those kind of activities.
Right. Now, explain to me about the cartilage, right? Because you obviously discovered that kind of when you went in. You saw the full extent of that.
Yeah, no, we did expect a little bit mild. I think I remember when you asked me how bad you expect the cartilage to be, and I told it can be mild. So we expected mild injury, but when I went inside, see, the knee has 3 compartments. 2 main compartments are one on the inside and one on the outside, and they are the ones where the weight bearing happens. All the weight bearing is taken by those 2 compartments, medial and lateral compartment, and the kneecap moves in the 3rd compartment. So your kneecap component was good. There was a little bit cartilage softening, but not anything major. The outer compartment, so that was good, that was pristine. But the inner compartment on the femur side, so each compartment has the leg component and the femur component. So the femur component had maybe about 1.5 centimeter in diameter and maybe about 2 centimeter diameter cartilage damage in the weight bearing area.
Right.
Now that damage we quantify as grade 1, 2, 3, 4, depending on how deep is the cartilage damage. So in grade 1, everything looks nice, but when I use a small probe, I can feel it to be soft. In grade 2, it becomes a little rough to the visible eye. And in grade 3, it almost goes towards the bone, and grade 4, it will be directly bone seen on the picture. So yours was somewhere between grade 2 and 3 in that area. So it was kind of moderate damage, not mild, moderate. But yeah, it was not severe either. So I hope that you still have.
All right. So it was important, that he explained kind of that because, of course, we're not physicians. We don't understand. But he's very, very good at explaining. Now, look at this. I'm going to show you. So when he goes in there, he made 2 tiny keyhole incisions. Like he said, there was no need to even stitch those incisions at all. So I don't have any stitches. He just glued it because they're so tiny. But look at what he found.
Hey, Sandra, I'm checking the kneecap cartilage now.
Oh my God, look at this.
And rough.
Have you ever wondered what inside of your knee looked like? To me, this is so fascinating. I said to my husband, look, you look at this video. He says, I don't want to look at that. He's can't stand this sight of anything. Like he's definitely could not have been a doctor. He looks like a doctor. He looks Indian. Everybody thinks Indians should be doctors, but not Marlon, honey child. He's like, oh hell no. But check this out. This is like so like interesting. I find this fascinating. I don't know about y'all, but I love this. Look at this.
Chondromalacia, maybe grade 2. And the lower part is the groove of the kneecap. That looks smooth and
that's
firm.
Like fluid in there.
That's a normal portion.
Wow.
And now I'm going to the inner aspect of your knee, and you can see
look at how messed up that was.
Significant cartilage damage.
That's the cartilage damage right there. Y'all see that? Oh my God. It looks like something had been gnawing on my cartilage.
It look like a pearl, but there is a lot of fraying, and then there is roughness of the cartilage.
Yes.
On the other hand, this part looks good. So we're going to smoothen the cartilage. Now let's
He's going to show you the before and after.
This is the outer part of your knee joint, lateral compartment. This meniscus looks good, and the cartilage also looks good. Now we go to the inner aspect. Here you see the tear right there. There is a radial tear of the medial meniscus. It's mainly in the white zone. So we're going to smoothen it by trimming. Because
apparently if it was like in a different zone, then the treatment would be different. You'd stitch it as opposed to smoothing it. But look, you can actually see the tear. This is like so fascinating to see inside your body. Like this is just amazing.
And using radio frequency ablator.
Yeah.
I'm using an instrument. These are small punches. They're hardly 3 to 5 millimeters in diameter. They look big on the screen. It's slowly taking maybe 0.5 millimeter or 1 millimeter of the white zone cartilage. So we're basically smoothing the tear so that it doesn't extend into the normal area. And this is a shaver which shaves and sucks up all the debris at the same time, making the meniscus smooth. And now I'm using the same shaver to take off the rough cartilage. So the most of the gross cartilage is removed with the shaver, and the fine work will be done by the radio frequency ablator. And now you can see that the radio frequency ablator is cinching the cartilage. It's not burning, it's not damaging it, but it's stabilizing it so that you can get a smooth cartilage, and hopefully it'll last for a long time.
So check this out. This is before. This is the cartilage area before, right? So look how ragged it looked. Like I said, looked like somebody had been chewing on it. And then look at it afterwards, how nice and smooth it is. So he said, you know, this will last forever. And so now I got to go in there, not forever, but you know what I mean? Long time. So I got to just make sure that I strengthen that area now and I'm careful. But isn't that amazing? That is just so absolutely before and after. Wow. That's pretty cool. Very, very interesting. Yep. Why is my door open? Who's walking in? Is that Zeus? Hi, Zeus. Good morning. Hi. So let's talk about post-surgery. Big shout out to Zeus. He was like my night nurse. He did not want to leave my side. He was hanging out with me all the time. Zeus is like, something is wrong. But of course, then he starts to want to walk on my leg. And I was like, oh God, you can't walk on my knee. But he could tell, poor little thing, he could tell something was up. He was like, oh, my mommy's not feeling good. So they do a compression bandage and then they do the brace on the outside. And of course, I do have crutches. So that's this. And I do have crutches. And I'm still using those, right? Can't drive for a hot minute. So I'm going to tell you the truth, though. Let's talk about pain, because I know everybody's like, okay, tell us about the pain level. The pain that I have had has been so minimal that I don't even want to call it pain. Like, I felt like I didn't even have to take any painkillers after this procedure, for real. The crutches have been the most challenging part because I've never actually had crutches before. So trying to walk on crutches is a little bit challenging for me because like balancing. The thing that you don't realize is when you're in a house, you've got steps, like your front porch has multiple levels of elevation. You don't think about any of these things in terms of like special needs situations until you're in it. Getting on the toilet, challenging. Big shout out to Kevin Watler. He's like, get one of those medical toilet razors with the handle. So, bless Marlon. He's been my nurse. So, he went and got one of those for me. Big shout out to Nathan. He sorted that out, installed it. Because, just getting in and up and down, so these little things help. Having handles, and don't go in the shower, the bathroom alone after you've had a surgery, because your fall rate, the PT said this to me, and I did fall right after surgery. The fall rate is significant because, my brain still isn't like, okay, this knee doesn't have the strength in it. And I went to turn to throw something in the garbage bin and it just gave out from underneath me. Thankfully, I fell on this side and on the side that I just had the surgery on, but no pain to speak of. Now, this morning, I had the most pain that I've had because I accidentally bumped into the knee. I was trying to get dressed by myself and my foot actually hit the knee. The other foot hit the knee. And I was like, oh, because now the compression is off. The extra cushioning is off. And it's just a little tape over some, so it's a little bit more exposed, right? They've got the waterproof bandage over it. And so I hit that. And that was the most pain that I've had because I really haven't had any pain. And I was living with so much pain before the procedure that this has been honestly a godsend. So I just want to thank everybody. Thank you to this beautiful physiotherapist, Melanie. Thank you so much to Dr. Niranjan. Thank you to all of the nurses, the anesthesiologist team. Really, really appreciate the entire staff there at Health City, Cayman Islands. I could not have asked for, honestly, a better experience. We got a caller in the line. Good morning, caller. Welcome to the program. Hello? Uh-oh. Hi, there you go. Hey, honey child.
Forever young. Happy birthday to you.
Aww.
Happy birthday to you.
Thank you.
Happy birthday, dear Sandra. Happy birthday to you.
Thank you so much. That's amazing.
How does it feel to be pain-free on your birthday?
Oh my God, it feels amazing. I'm just so grateful. Really and truly. Unless you've lived with chronic pain, I know that there are people who suffer from chronic pain like even worse. It's not something that you should have to live with, and you don't have to live with it. That was the whole point, I think, of my, message this morning. But yeah, it feels good. It feels good to know that I'm on the mends. And October, I'll be back on the pickleball court, ready to tear up Premier Andre again. So yeah, I'm so happy. Thank you so much to all of you. I see all of your amazing birthday greetings. Thank you so very, very much, everyone. And of course, thank you for the birthday song. I appreciate it.
Enjoy your day. Take it easy.
Thank you. So we do have other people who share my birthday today. So I want to do a big birthday shout out to Sue. Sue also shares the exact same birthday. So she's my birthday twin. I think David Dixon from DVDL is also a birthday twin. So his birthday is today as well. We had a couple days ago, Al Ebanks celebrated his birthday. We've got Dr. Sydney Ebanks who celebrates a birthday on the, I think he's like maybe the 8th or so. So he celebrates a birthday in August. We have, oh my gosh, there's so many August birthdays. I'm just trying to remember. There's a lot of them. Tina Trumbach. Her birthday, I think, was a couple days ago. So lots and lots of birthday celebrations. And yes, there are people who share my exact same birthday. There's actually Melanie. I'm trying to remember her. She's from East End. There's Claude Lewis. Big shout out to you. Blake Rogers over at Stingray Media. His birthday was on the 16th. Melanie shares, I think she's my same year and same day, obviously. So she's like my real birthday twin. So yeah, big shout out to all of you. Even Austin. Austin had a birthday on the 16th as well. Austin Harris. Shout out to Austin. Behave yourself over there, but good one. Grayson McLean, he's on the 16th as well. Tracy Ross was the 17th. That was yesterday. So lots of birthdays. Josh Akinichi, he celebrated yesterday also. So thank you guys so much. Lacey Barnes, she is tomorrow. She's the 19th. Yeah, so Joyce Ann. Hey, Miss Joyce Ann is tomorrow as well. Look at that. Cousin Albert McPhail, he's the 19th. Frederick Wilkes is tomorrow. So lots. Miss Laurel Hides is tomorrow. So lots of amazing birthdays. Nico is coming up on the 20th. Nico McPhail. So yeah, lots of August babies. It is definitely the most popular birth month. I'm pretty sure about that. So thank you guys so much. Thank you, Miss Rose. And so many of you have been checking in on me post-surgery. And I just want to say, I really, really do appreciate you checking in. And I was so happy to report that I just felt so good. Everything was fantastic. Everything was fine. And yeah, I mean, I could not have asked, I think, for a better experience. So I'm on the mends and I'm able to walk around a little bit without the crutches. But, you know, I'm not trying to overdo it. I'm not trying to play hero here. I'm just trying to take the advice of slow recovery, slow and steady wins the race. And yeah, we're doing good. So let's move on to a couple other things. You know, on Wednesday, we were we were talking about the slackness over at the DPP's office. Look at my face, honey child, when I say that. And how they could take such a simple, it is quite a simple file in relation to Larry, Linda, and the young man, and take months to review this file and come to a conclusion. That's unacceptable. In the legal profession, listen, you guys might not know this, but when I was in law school, I had a stint at the time, it wasn't called the DPP's office. It was called, I think it was all considered part of the same legal department or whatever, but the prosecution side of things. And so we, of course, it was a very interesting experience. Let me just tell you, I saw things in file that were like, this is how this works. So I'm no expert, but I got a little bit of a glimpse. This is way back in law school. For me was 1997 to 2000, I think. So I might have been there in 2000 or maybe 99. I can't remember the exact date, but I did a little bit of, it was like coming into like the last bit of my law school just to get some experience in something other than corporate. I kind of went over there for a little bit. And so I know how the files come in, how they get assigned, and all that stuff, right? It doesn't take a QC to make a ruling on this type of file. It is actually very, very straightforward. And this is what I was saying last week, Wednesday. Why is it taking them so long? Like something just seems a little bit off to me that it was taking them so long to make a decision. It's like they didn't want to make a decision. They were scared. Anyway, it was no surprise to me then that I said that on Wednesday, and by Thursday, all of a sudden the police released a statement that, there's been a decision and this is how we're charging people. They listen and they pay attention. Well, thank God somebody's paying attention around, yeah. But still, the slackness should stop. Now, I am disappointed in the DPP's office, but I'm not surprised. When they came back and they said that they were charging both the young man and Larry, local Larry, everybody was like, what are they charging the young man for? I'll tell you what. This is where I feel like they're trying to appease everybody, but they're not getting it right. Okay. So they charged a teenager, 17 years old, for what do they charge him for? Inconsiderate driving. What the Ross? Every single one of you is like, is that a real charge? I gotta be honest with you. I have never actually heard of anybody, and I do mean anybody in Cayman, being charged with inconsiderate driving. I did not even know that was on the books. So the fact that they charged, you know what that says to me? They were digging hard to try to find something to charge this young man with. That is the height of legal stupidity, if you ask me. Inconsiderate driving? Do you know every single one of us should be charged probably on a weekly basis with inconsiderate driving? Every time you pull out and you don't put on your indicator, though, that's inconsiderate driving. You brake a little bit too hard, you don't give enough car length. Every one of y'all, including myself, inconsiderate drivers at times. And why is it that we've never heard about this type of thing before, this type of a charge? You know why? Because this is what you call trumped up charges, pun intended. Come on, DPP's office. This is the best that you got? Inconsiderate driving. Wow. Let me look at the traffic law. Because like I said, if you take the common understanding of what inconsiderate means, and I'm sure there's no specific definition in it, inconsiderate driving would apply to all of us. We are all inconsiderate drivers on occasion. So the fact that he pulled out in front of Larry, which is what started this whole hot mess of a situation, and got Larry, let me see where inconsiderate, I'm assuming it's in the traffic law here, careless or inconsiderate driving, section 44. Now, I've heard of careless driving, which is a higher degree, obviously, of culpability involved. I've just never heard of inconsiderate driving. So it says here that a person who drives a vehicle or animal on a road without care and attention and without reasonable consideration for others commits an offense and is liable on summary conviction to a fine of $1,000 or to imprisonment for a term of 6 months or to both. Wow. When a person is convicted of an offense under subsection 1, the court may order that the person be disqualified from holding or obtaining a driver's license for such period not exceeding 12 months as the court may order, and the particulars of the conviction shall be endorsed on the person's driving record. So that's all it says about inconsiderate driving, section 77 of the Traffic Act 2023 revision. So I'm sitting here going, careless driving is, I think, a higher elevation offense than inconsiderate driving. I am flabbergasted. Let me see if I can find something here. I think that this is one of those situations where the DPP's office felt the need, and I have no clue why, felt the pressure from Larry's people to just throw something on the young man as well, to try to we're going to make it equal on both sides. Everybody's getting charged. It's like when Oprah walks in, everybody gets a car, so nobody gets their feelings hurt. This is the opposite of that. Everybody gets charged, so Larry doesn't lawyer up and be like, well, he slammed his brakes in front of me, so that was my justification. This is just stupid. This is the height of stupidity. Good morning, caller.
Good morning, cousin Auntie Sandy.
Morning. How you doing?
I could not wait for this matter to be discussed. And I can't express how disgusted I am with the DPP. for even bringing, I am sure more than 95% of the drivers in Cayman, excluding possibly police and traffic officers, and some of them may not even know themselves, that inconsiderate driving is actually a traffic offense. I think it is beyond flabbergasted. There's another word. I don't know. Let's find it. But it is beyond disgusting and distasteful that just exactly the example you use. It's kind of like Oprah. You get a car, you get a car. But in this case, you get charged and you get charged and you get charged. It just seems as just what you said. Or we don't want to upset Larry. So I don't think that brake checking, which is what was allegedly done, the young man slammed on his brakes, that in itself is not an offense. If somebody, I'm sure I'm guilty of it. If somebody is tailgating me too close for my comfort, I may not have slammed on them, but I've certainly pressed my brakes to brake check them, and it is dangerous. And I'm not trying to dispute or disagree that the young man may or may not have engaged in something that could have potentially been dangerous. But like I said, how often, I would like to know the statistics on how often someone has been levied or charged with the offense of inconsiderate driving.
Yeah.
Because inconsiderate driving can be something as simple as persons pulling onto the road, persons merging in front of you.
Not enough space between vehicles. Like everything is inconsiderate driving.
So, I mean, are we going to now clog up the entire court system with persons who have driven inconsiderately? I mean, just this morning, I posted that, the heroes, that not all heroes wear capes, and but the ones who use their indicators are just really high on my list. People who don't use indicators, that's also inconsiderate.
Yes.
I'm literally driving behind a vehicle as we speak who didn't use their indicator to pull in front of another vehicle, almost caused an accident. While I'm speaking to you, and my dash cam is running. Right? And I'm saying this happens every day.
Thank God for that CMR dash cam, girl.
Let me tell you, that's a free plug. We'll get you dash cam. It's really sad and an indictment on the DPP and the RCIPS that young man would have even been charged, because the message, in my opinion, that it sends is that someone has treated you inconsiderately in their driving. You can now get out of your car, put your hands on them, and that person is, in some regard, as guilty as you are. For you simply cut them off. You simply brake check them. The next thing that's going to happen in this country, and I'm afraid that the dangerous precedent that this message and this charging is going to send is that somebody is going to upset somebody to the point of, I've literally been run off the road with my children in my car.
My God.
And, the message that I'm afraid that this is going to send, someone is going to follow someone and beat them to a bloody pulp and say, use that case as a precedent. I will stand before a judge because this person was inconsiderate, and their inconsideration almost caused me to kill my kids or get in a really bad accident, and this is my justification. And there are people who will happily stand before a judge and say, I did this because X, or I did this because Y. And I'm just really, really disgusted with the DPP today. There's so many things out there. Why aren't they ticketing those inconsiderate truck drivers who are carrying loads well above what they should be carrying? In my opinion, not carrying them properly. What about the people running around here with no brake lights? What about the people? I saw a vehicle the other day. Not only did he have no brake lights, the piece, like the truck looked as though it was under repair. The piece legitimately where the light should be did not exist. There were no lights. There were just empty cavities for where lights should go. Where are the police in these instances? Parked off on the side of the road trying to get tickets. I will leave you there.
They were probably out there being inconsiderate drivers themselves. I'm just saying.
Yesterday I saw an emergency vehicle, a police vehicle, going up on West Bay Road, who just pelted down the middle of traffic. The siren wasn't even loud enough for, in my opinion, for motorists to hear. It's not that my radio was up, and I even said it to my passenger, did you hear that siren? And he said, no, but I saw the light. And I'm saying, but they're like, what in the world? And he literally cleared 2 lanes of traffic by belting down the West Bay Road. I have it on dash cam, so they better not try disputing it, you know. But it's just
I think every single time now I see an inconsiderate driver, I can call police and say you need to charge them with inconsiderate driving, and I have the dash cam evidence for it.
Like I said, this is my concern. This is the concern that I was afraid, you know, would actually be what would be happening, is that people are going to start taking matters into their own hands, or people are just going to be so disgusted now that they're going to, more or less, start tailing people and saying, oh, but he turned in front of me, he didn't wait, he tailgated me. Because to me, those are even more dangerous infractions than brake checking per se. Some may disagree. But in a nutshell, I don't know what we're doing. I really don't know what we're doing. It's exactly as you said. You get charged and you get charged and you get charged. Let Larry, as I speak, I'm sitting in a parking lot. There's a vehicle driving with trash that is literally flying out of it.
That's inconsiderate to all of us.
But not only is it inconsiderate, you're littering, which is also an offense.
Yeah, but they're not going to be chasing them.
Where are the police in these instances? It just sends a bad message and sets a bad tone for everyone. You know, people are going to be super vigilant now. Not that I'm not suggesting that they shouldn't be, but people are going to be hyper vigilant to these types of things, and they're going to want their justice as well. And I'm afraid we're going to clog the system with frivolous stuff instead of catching legitimate, careless and inconsiderate drivers, those driving without license, those driving without insurance, those driving vehicles that shouldn't be on the road with no light, no brakes, no all sorts. But I'll leave you there.
Thank you. I appreciate it. What a mess. Yeah, I mean, it's ridiculous. So I've done a little bit of research here under UK law, because most of our legislation is closely following UK legislation. Sometimes it's verbatim. We don't change a word. We don't do nothing. So under UK law, both careless and inconsiderate driving fall under Section 3 of the Road Traffic Act 1988, but there are two distinct differences between them. One, careless driving without due care and attention, is defined as when the standard of driving falls below what would be expected of a competent and careful driver, but not to a grossly dangerous degree. The focus is on the driver's lack of attention or care, regardless of whether other road users are directly affected. Examples: accidentally running a red light, being distracted by adjusting the radio, or failing to look properly before turning. Inconsiderate driving is driving without reasonable consideration. Occurs when a driver behaves in a way that does not show reasonable consideration for other people using the road, and these other users are actually inconvenienced by the behavior. For a conviction, it must be shown that both the conduct was inconsiderate and that it inconvenienced another person. So this is now where we get into the whole bit of, Larry was inconvenienced because, that's what precipitated him getting out of the vehicle and acting like a raging lunatic. So that's his excuse. That's his defense that he's going to use in his own case as to why he acted in the way that he did. So it has to be proven two elements: that it was both the conduct was inconsiderate and that it actually inconvenienced another person. So what they're saying is it's not enough that it's just inconsiderate. So this is kind of interesting because here we are. I guess we were watering it down a little bit because, like I said, lots of us are not using indicators. But there's a second element to this, is that it actually has to inconvenience another person. Interesting. So if you use your indicator or you don't use your indicator and it doesn't inconvenience someone, then based on this, that means that it's actually not an offense. So it's like a 2-barrel requirement for it to be an offense. So it goes on to say aggressively flashing lights to force others to give way, unnecessarily braking or slowing down, hogging the middle lane, are using full beam headlights to dazzle approaching drivers. So those are some examples. Then it goes on to say, in summary, careless driving is about failing to reach the expected standard of attention or care, where considerate driving specifically involves behavior that is inconsiderate or inconveniences other road users. Both are offenses and can carry fines, penalty points, or even driving ban in more serious cases. The most interesting thing, though, about the inconsiderate part here, it says it requires proof that someone else was inconvenienced by the manner of driving. So that now is where I'm sure Larry is going to be trying to pull out his footage off of that Tesla cyber drunk and come forward and say that, oh yeah, I was inconvenienced by it. And this is why I say that. We don't know exactly what evidence they have. We don't know, I do know that Tesla has a very good, what would we call a recording system. They have, I think, probably the best there is, with, basically 360 cameras on those vehicles. So you got all sorts of different camera angles on those vehicles, right? So I'm assuming now that Larry and him lawyering up is going to be able to show evidence of, oh, supposedly this guy braked in front of me or he pulled out in front of me, and that's what got me started acting like a friggin' lunatic. Now, I do want to talk about Larry's charges here in a second, but let's take this call. Good morning, caller.
Morning, Sandy. How are you doing?
Morning, not bad. How are you?
I think we'll make inconsiderate the catchword for the day.
Yeah, right?
Let me break it down into a West Bay vernacular a little bit. You got the inconsiderate drivers driving inconsiderately. Be in charge with inconsiderate traffic laws by inconsiderate police officers. So I think that about sums it up. When you see, a few months ago, I'm talking about the riffraff. But our riffraff is all imported. And the riffraff, the local riffraff, they caught that, they caught it from them. As they step off the airplane, the book of rules that they had where they come from, they told that over their shoulder. Now they use it now. They make their own rules when they come at. These people are not being held accountable. This is in some other countries it would be called a Shangri-La. But this is a Shangri-La that we got going on. But this is all the skanks and everything that come in. They make their own rules. They live by their own something, and they have no accountability. So anybody.
Yep.
We just let them do what they please.
Yeah.
So this government got a lot. It's not just the immigration that they got checked, but after they get them, they got. I heard Julie heard her before the election. She said one thing she see that needs to be addressed, and that is these multinational, transnational companies that you got here making billions of dollars out of this domicile, right? And is being charged a rate that is less than negligent. You understand? You come here to make billions, and you pay millions. They need to be. It's not fair across the board. You understand? So I'll leave it with that.
Thank you so much, my darling.
Right.
Really, really appreciate it. Yeah, I mean, look, this is a hot mess and then some. In fact, somebody just said to me, and I want to look at this, that the consequences for inconsiderate driving is actually more than for common assault. I'm like, what the? Say what? No, sir. Come again? Oh my God. Yeah. We got some problems. We got some problems. So They actually do have a list of inconsiderate driving. Let me scroll down a little bit more. Examples of inconsiderate driving. Let me just see which page this is on. Caller, good morning and welcome to the program.
Morning, Auntie Sandy. How's
Morning.
it going?
Not bad.
Good to see that you survived your surgery there. Just trying to make sure that you're able to stand up and bake brownies in the very near future.
I don't think my brownie making has been impeded in any way.
All right, so there's no excuses then. The weekend's coming up. Get on it. Seriously, I'm calling because I'm just going to say this. First of all, let me applaud that young man and that the victim and his parents, because they have shown a level of class, decency, and restraint that I know I wouldn't have, and I'm assuming a lot of other Caymanian families and parents would not. They have been really, really, really gracious in what can be termed as nothing more than a racist assault by two bigots that should never be afforded the privilege of living and being given the privilege of permanent residency or Caymanian status. So if we're talking about what is inconsiderate, we should hold these two up as shining examples of what we don't want as a country, what we don't need in the country, and two people that must not ever be given the right, the privilege, and the honor to call Cayman home. They exemplify all that is wrong in modern Cayman, and the fact that it's been captured by multiple camera angles, multiple recordings. This is the easiest decision in the world for the permanent residency and status board to make. If these people are crazy enough to apply, we need to close the loopholes so that you can't apply to get PR via means or investment. The Cayman Islands does not need characters like these two inconsiderate bigots who attacked a child, got out of their vehicle, attacked a young man, got out of their vehicle to assault him in his own car for what the authorities now are describing as inconsiderate driving. Really? If that is what sets you off, what would happen if there was something significant? And I'll just go on record as saying, every Caymanian that loves this place, everybody that has become Caymanian, everybody that calls Cayman home, we have to rally around each other and ensure that people like Crazy Larry, his wife, and any other bigot who exists that is prepared to assault somebody, you can only imagine what they really think in their heart and in their circles and in the conversations that they had. Because that could have been your kid, that could have been my kid, and I can say this, I'm not a violent person, I'm not a gangster, I'm not a tough guy, but I would go to any length of this earth to destroy him physically, financially, and ensure that he faces the full gamut of legal recourses, because nobody is supposed to react like that during rush hour traffic in the Cayman Islands. Save that bullshit for Texas.
We're still on radio, honey.
Sorry, it's 9:30 yet?
No.
Oh, sorry, my bad. Sorry, Sandy. Sorry. But the fact that he could feel that comfortable and displays that level of ignorance, he has friends who probably think, talk, and feel exactly the same way. And now they need to understand, we will make an example of all of you in the same way that we will make an example of Crazy Larry and his wife and ensure, yeah, you can come and visit Cayman. Yeah, you might be able to buy property in Cayman, but you cannot live amongst us, and you can never be given the privilege and the honor of having security of tenure via permanent residency, or more importantly, Caymanian status. If there's one thing that Caymanians must agree upon this morning, it is this, because that is somebody else's child that was subjected to that. That could be me, that could be you, that could be our children.
Yeah.
And there are too many people that would not show the grace of what the Jackson family demonstrated.
Yep.
And so this is a rallying cry for everybody that is Caymanian, whether you're here by birth or whether you've been given that privilege to draw the line in the sand. We will not tolerate that
Yes.
from anybody. It doesn't matter if you're rich, poor, black, white, green, purple, or from outer space.
Yeah.
It starts
Absolutely.
today. So that's all I wanted to say.
Thank you so much.
Please push, and please let's hold the DPP. So help me Christ. How we get to the stage where we're charging a inconsiderate driving? Really?
Yeah, they're just looking for an excuse, like I said, to charge that boy with something. He could have farted, and that would have been inconsiderate driving.
Well,
they got to do better.
We have now reached the point where enough is enough is enough, because if people get away with this, it's going to happen more often.
Of course.
And it's going to happen to the wrong people. And then we're going to have chaos and anarchy. So keep doing what you do. Thank you very much, Anthony.
Thanks, Riohan. I appreciate it.
Yeah.
You know, I wish, I'm going to say this now. I wish that there was an option to elevate this charge for the young man to the Grand Court, where it would be a jury trial as opposed to, anything else. Judge alone, because these are summary court matters, so they're judge alone. I do wish that this could be elevated to jury trial, because trust me, they could not find a single Caymanian group of people, jurors, who would convict this young man of inconsiderate driving under these circumstances. And so it is unfortunate that this type of offense, these traffic offenses, are not open to going to a jury. It is the height of ridiculousness. And on the one hand, it demonstrates how disconnected the DPP's office is from what's actually happening in this country. They don't have a clue. They don't care. They're not connected to the community in any way, shape, or form. Now, to their credit, they are supposed to be objective, or subjective, yes. Where maybe they don't think about anything, they're just looking at the law and they make a decision based on the law. But I'm curious as to what evidence, because for all offenses, you have to be prepared to look at the evidence and see what evidence is actually available. So I'm curious as to what evidence is available to demonstrate. It's like they were digging so hard to find this minuscule charge. And thank you so much to one of our listeners who points out in the definition section of the traffic law what inconsiderate driving includes. So flashing of lights to pressure other drivers in front to give way, misuse of a lane to avoid queuing or to gain some other advantage over drivers, unnecessarily remaining in a overtaking lane, driving slowly. So those are your grannies who are driving slow, you soon get charged too. I hate to tell you. Or braking without good cause, driving with undipped lights. Oh, this is when your high beams are on. Dazzling oncoming drivers. So even having your your high beams, that's inconsiderate driving too. Wow. Driving through a puddle, causing pedestrians to be splashed. Oh my God, how many times have we not seen that happen? And driving a bus in such a way as to cause, as to alarm the passengers. So a whole list of examples includes, but of course there'd be other things that probably could be that this is, I doubt, an exhaustive list, right? Wow. So then Larry got the privilege of being charged with common assault. So common assault should be defined in the penal code. Let me just have a quick perusal here of our penal act now. Let me see what version we're up to. So common assault is normally when there is no damage caused to the person. Let me get the definition here. So we're going to start a petition here shortly this morning. We're supposed to do it when we had the protest about Larry and Linda, and somebody else I think was charged with it. It hasn't been completed. So I will take charge of it this morning, and I'm going to put up this petition. Here's the objective of the petition. Larry and Linda have become personas non gratis in this country. We cannot have people like that who respond the way in which they did, right? and have yet to issue any sort of a public apology, yet to admit that clearly they overreacted. I don't care what kind of inconsiderate driving, they think happened here. They have acted in such a way that has demonstrated that they're not the type of people that we would want in our shores or on our shores. And so at the end of the day, it is what it is. We got a petition. So, I know you guys are sitting back waiting on the MPs to do something. You said, the permanent residency board. Those boards can't do anything in lieu of a petition or something else coming to their attention. They can't just sit down in their, we're going to just exercise this power that we don't necessarily have. If we put a petition together, it's more likely to be impactful. And I've actually looked into this, and I've spoken to some of the authorities that, are on the immigration side of things. And my understanding is, and I'm not finished with Larry either, because apparently he also treats his workers in his company, in his organization, like garbage. And so we will be publicly highlighting and providing that information as well. And so at the time that this incident happened, my understanding was he was actually applying for PR. I mean, I do find it, I struggle with the concept that you could be in somebody else's country applying for PR, and this is the kind of behavior that you're exhibiting in public. Imagine when you get PR, imagine when you get status, how bold and ridiculous you are going to be. Not today, Bobo. So yes, I don't care how much money he claims that he has. I mean, he's been for quite some time now in this country trying to find a way in. The funny thing is, so many of them are not as rich as they want us to believe. They come here flossing with a few dollars. A lot of them, over exaggerate their financial position, but we don't know no better. And we believe the foolishness with their flashy lifestyle. We buy into it, and we give them status, but they're trying to nickel and dime and not pay people properly and do all kind of stuff because that's the type of people that they are. We don't need you, and we don't need your money. Not for all the money in the world should you allow people like this into your country, because they become the pariahs that you'll never be able to get away from. Right? So once he gets Cayman status, Lord, the dog eating her supper would be the least of her worries. These are the people who really go out there and then really act out even worse. You're acting like this on the heel of an application for PR. Like, seriously? Whoa. No, sir. So El Rey says it's too late for apologies. They've shown us who they. Oh, no. I agree. I'm saying he didn't even have the decency at the time to man up and said, listen, I was drunk or something and I overreacted. I was trying to protect my lunatic of a wife. She overreacted and went on like an idiot. And this is how we are, but we're still sorry. They didn't do that at the time. So there's no sincerity now in any kind of apology that would be forthcoming at this time. That much I can tell you. So I'm going to start the petition. It's going to be an online petition. You can virtually sign it. Share it with as many people as you possibly can, because the idea, folks, is to ensure that we get this to the respective people. I'm just trying to find something here. We get this to the respective people who can actually do something about Larry and Linda. Larry and Linda, we don't want you here. I mean, I want you to understand this, right? I don't personally know you. And like I said, it's so ironic that I've actually sat down at Yacht Club and broken bread with Larry and didn't even know it. This was years ago. Okay. Obviously, he didn't show me this side of himself. But as we were talking about it, somebody reminded me, oh, you don't know who he is? And I was like, oh, really? Okay. So I don't have no bone to pick with you, except your behavior has demonstrated I need to be gnawing on your bone. Like how my cartilage looked all chewed up. That's a bone I need to pick with y'all. You are horrible neighbors. The people in North Side don't want you there. They talk about your behavior all the time, how you're always inconsiderate, always encroaching on their property, always being rude to people, having the most to say. You have demonstrated this isn't a one-off incident. This has been a pattern of behavior where Larry and Linda have demonstrated that they do not mean the people of the Cayman Islands any good, and that they're a bunch of, thank God it's 9:25. We are going to a little bit of overtime this morning. I'm not gonna stay too long because my knee's still recovering. But they're the very definition of what we would call riffraff and of what we do not want in this country. So we have an opportunity before they get any further to get rid of them. I'm trying to find something about the protest that we had. When was that again? And I sure hope the young man installed the dash cam. I gifted him one of the dash cams because he had one, but without audio. You got to have the audio and everything on these, child, because I tell you what, no, sir. The Larrys and Lindas of the world, they really make you question your own sanity. And like Johan said, that the sad thing about it, right, is as parents, we know the madness that is in this world, and no parent, I mean, I can't even imagine how upset, that family must have been. No parent would ever want this to happen to their child. And you see, when you get to actually see the video footage of how your child was assaulted by the likes of Larry and Linda, it would take everything in you to not have other charges filed when you finish with Larry and Linda. Boxer upside her head too. So as Caymanians, I'm here saying we don't advocate violence, right? We're trying to be good, sensible people. We're trying to follow the law. We're trying to do things the right way. But there are times, especially when people mess with your children, that boy, let me sip on my water. It's still 9:26. I'm counting down, as you can see. There comes a point in time when you really want to lay some holy hands on people. You know what I'm saying? And I'm so not like a violent person, but I tell you what, you do that to my child, and we'd have to have a different kind of conversation. In fact, I might be the one laying hands on you, but I gotta find somebody to box you upside your head, Larry, because you were just completely out of order. Now, I don't know what the family has done. I know that they were talking to attorneys at the time. So hopefully they are continuing to pursue their legal options. So look at this now that this other person has sent me about common assault. So they said the sentencing for common assault is actually far less. Can you imagine that BS? 920. Denny, take us into 928 so I can just be free to say what I really want to say.
No, actually, I called you to tell you that I'll be calling after 9:30.
Oh, but hold on. Hold on. Let me check the time feed. I think technically we're done. Yeah. Okay. So we can come off radio. Let me hit the end feed real quick. How do I think I just leave I had to connect separately today, so I think I just leave. Hold on. Hopefully we're disconnected. I'll forgive if we're not. You'll have to understand. I think we're disconnected because technically it's 9:28. What the fuck is going on? Seriously.
Well,
what is the DPP's office doing?
I'm actually going to tell you exactly what the fuck is going on.
This is
listen to me.
Mm-hmm.
This is gonna get quite legal, okay?
Mm-hmm.
But I know you can handle it.
Mm-hmm.
So you'll have to translate for anyone who can't comprehend or get distracted.
Mm-hmm.
There was a firearms owner who was renewing a license.
Mm-hmm.
And the commissioner decided that he wanted ballistics tests done on the firearm before he would renew it. That power didn't exist in law. He insisted, the person appealed, the government agreed with the commissioner that, he had the power to do that. And so the person then capitulated, did the test, got his firearms renewed. And then the government turns around and changes the law to give the commissioner of police the power to collect ballistic testing.
Mm-hmm.
You know why? Because the commissioner of police was acting like all of the other criminals that he prosecutes. He was acting without authority. Okay? But you see, when you're the government and you have buddies that you're wanting to protect, you do anything to make sure they look good. The commissioner of police is scum. The commissioner of police is acting like a criminal. The only thing helping him is that he has politicians just like him helping him. And you want me to tell you something else? The courts are no better. All right? That's what's actually happening here. And this charge about inconsiderate driving, that is to ensure that the commissioner of police doesn't have to answer for the wrong that was done by that officer who didn't properly investigate before arresting that young man. Now that they have this charge,
they're trying to protect themselves.
It's plausible deniability that they weren't wrong.
Right. Yeah. Yes. I'm glad that you brought that up, Denny, because of course I wasn't recalling all the details of this incident where they have really mishandled the situation. So the likelihood of them trying to trump up a charge on this young man post to try and bolster their position of why they arrested him and not Larry is, I guess they're trying to make an after the fact argument with this bogus charge. It's a good point.
That's what's happening.
Yeah.
And let me tell you the lesson that the public needs to take away from this. The chief law enforcement officer will do anything to make sure that he doesn't look bad. I'm afraid to tell you, the public, that this is much worse than what you think it is. Okay? That's the consistent attitude they have. They will never, ever admit that anything is wrong. The Attorney General's office, in the case of where it's Anglin versus the Ministry of Health. Okay, you should know that in discovery, they're supposed to release to you all of the relevant information you need to argue your case. They have a written agreement in that case where that information would be revealed, that they would, in discovery, be able to get the information. In spite of having an agreement, they had to fight over a year and still didn't get all of the information. This is how disingenuous what we call the legal system is. It is an absolute joke. I could say more, but I'll stop there for now. What's happening to this young man is a tragedy that we should not accept under any circumstances. I don't know if you can hear me, but I can't hear you.
My apologies. Sorry, I had muted myself because I was doing some typing. But yes, no, I agree. I agree 1,000%. Absolutely ridiculous. Thank you so much, Denny.
All right, take care.
Yeah, I mean, this is straight up bullshit. I mean, I don't know any other way to describe this. And last week I was almost kicking myself. I was like, oh man, I'm not gonna have a show on Friday or Thursday because I was really just trying to rest post surgery. But trust me, I was burning up when I saw this. Wow, this is the best that they could do. It's a good point that I had actually forgotten that Denny made, is that, remember now, there is a very, very substantial argument here that the RCIPS mishandled this arrest and their officers mishandled the situation at the scene. And so to now cover their big asses in a proverbial way, I mean, they are now trumping up a charge on this young man to say, see, that's why we arrested him. Nah, there was nobody and I don't know who can get this case, but I hope it's a sensible judge. There was no one at the scene. And what was it that they arrested him on again? Somebody remind me. I need the phone number. I'm trying to find the phone number of his family member when this incident happened. Because I do want to actually speak with her, but I'm trying to remember, what was it that they had initially arrested him for again? It definitely wasn't inconsiderate driving. I can tell you that much. Let me see here now. Was this back in, somebody help me find his sister's number, because I really want to ask her a question, because I'm pretty sure that they did not arrest him for anything like this, because it's now like, okay, now their brains have been thinking about this for a minute. They're completely making this up. Yeah, we're not feeling this, DPP's office. And this is where you see the people of this country will not respect you. When you make decisions like this, in a very public case like this, where we're all watching, we're all paying attention, the people of this country will not respect the DPP's office. They're going to lose respect, as Denny rightfully said, even for the police. Because to this day, we have not heard a single word from the police department about what they have done in relation to investigating how their officers handle the matter at the scene. But now they're going to backtrack and say, no, look at this big time offense, inconsiderate driving. So our officers handle it right. He should have been arrested. That's bullshit. Let me see here. So suspicion, he was arrested on suspicion of actual bodily harm. Let me try to confirm that. Because if that's the case, that is nowhere near what we're dealing with now. And in fact, the ironic thing about it is not even Larry has been charged with actual bodily harm. He's been charged with a watered down physical violence offense, which is common assault. So I am woefully, let me just pull up something else here. I'm woefully disappointed in the DPP's office, but I'm not surprised. You see, very little that they do over there surprises me. This is to be expected from them. They're not much better. Don't expect nothing from them. So common assault is where a person who unlawfully assaults another commits an offense if the assault is not committed in circumstances for which a greater punishment is provided by this or any other law, is liable to imprisonment for 1 year. But let's see what the definition now of common assault is. So hold on a second. There should be. Let me just pull up here. So this would be in the penal code. It looks like we're looking at the 2019 revision. And so common assault is considered a summary offense generally prosecuted in the magistrate's court and carries a maximum sentence of 1 year in prison if found guilty, unless the circumstances warrant a more serious charge, such as assault causing actual bodily harm or assault with a weapon. In summary, common assault in the Cayman Islands is any unlawful act that intentionally or recklessly causes another person to fear immediate physical force or actually inflicts minimal force, but does not involve serious injury or aggravated circumstances. Now, I don't know what they'd be considered an aggravated circumstance, but in my mind, the circumstances under which this happened on a public roadway and all these other things, in my mind, all of that adds up to be aggravating circumstances. So again, I remain very, very disappointed, not surprised, but disappointed in the DPP's office. Live it. Jay says that man boasts about how he can get away with anything and how much shares you have in the port. What? And all different organizations in Grand Cayman. How much shares he has in the port? I don't know nothing about that. But oh, he's bigoted, you know. Don't twist it. I have heard enough about him, enough stories about him to know exactly the kind of person that he is. So it wouldn't surprise me. I mean, he's not got no shares in the report because that's government owned. But no telling what other lies he had to telling people, whatever. So yeah, that comes with territory, big assholes. Andrew, thank you so much, Andrew Francis, for the birthday greetings. I appreciate it. He says, maybe I'll meet you up in Foster's again. Appreciate it, my dear. Thank you, Kimmy, Selena, and everybody else for all the amazing birthday greetings. So yeah, so examples of common assault. And let me see here. And you don't have to have physically touched anyone for common assault to occur. So as you guys know, my own sister is facing a charge of common assault for, the day that she decided to try to assault me. Because although she didn't really put her hands on me, it still fits the definition of common assault. So let me show you the definition here. So common assault under the Cayman Islands, or actions that constitutes common assault under the Cayman Islands law, include any act where a person unlawfully applies force to another person or causes that person to fear immediate and unlawful violence. This includes both actual physical contact, however minor, and actions or gestures that intentionally or recklessly cause someone to anticipate being subjected to immediate force or violence, even if no contact occurs. So I think in that instance, her hands might have touched mine, but it wasn't anything significant. Even that is common assault. Even putting your hands up, right? In a position like this, that is common assault. So all of us feel like what Larry did was a little bit more than common assault, but of course it includes things like striking, slapping another person, pushing, shoving, or grabbing someone, raising a fist in a threatening manner, causing someone to fear that they'll be hit, throwing an object at someone, even if it misses, if it causes fear of immediate harm, making a verbal threat coupled with physical gestures indicating imminent violence. So all of that would be examples of common assault. What's essential is the intent or recklessness in causing another person to fear immediate unlawful violence or to experience minor unwanted physical contact. The law draws a distinction between actual bodily harm, which involves injury, and common assault, which can occur without lasting injury, but still represents an unlawful application of force or the creation of fear of such force. So I am curious, I can't recall off the top of my head what the young man had in terms of his injuries. You guys might have to remind me about that one. But yes, I really feel like common assault is not enough. Oh boy, what a hot mess. So, the DPP's office hasn't really done anything to alleviate any real concerns in this community. If anything, they've just pissed us off even more. Truth be told. All right, this person says the following. Why isn't Larry being charged with cruelty to a child? Christopher is a minor. The DPP's office and the RCAPS are trying to find a way to ruin a young man's future with imprisonment. It's evident from the moment RCAPS arrested young Christopher Jackson and charged him with assault occasioning actual bodily harm. I was so disappointed. I am so disappointed in Kurt Walton as well. Shame, shame, shame. The DPP is arguably also trying to protect Larry from losing permanent status. Otherwise, more serious charges would have been filed against him. Mm-hmm. That's why we got to get underway with that petition and really let WRC know that he is not a person that we wish to have in this country. And enough of y'all sign that petition, I believe it can make a difference. Yeah, so initially they had arrested young Christopher with assault ABH. Can you imagine? What a mess. No, sir. Wow. I don't know what to say. accept it. This is just unacceptable. Okay. Let me just see here. This person says because they, hold on, because they believe, oh, hold on. Let me just grab this one. This is a bit more than I thought I had seen. Just trying to make sure. Oh, so someone has a comment, which I think is a good one, actually, where they say, this is Mary making a comment here. Let me just see if I can find it again. Asking about how Larry basically was trying to get into the car, if that does not constitute a separate offense as well. Donna Marie says, good morning, Sandra. I'm very disappointed in the DPP's office. I don't know what's going on or who's in charge, but they need to do some cleaning up. Girl. The problem with them is they keep cleaning up and putting the same type of people in. We find them from the UK, apparently, the brightest of the bright. We all know we can't find a decent Caymanian that could head up the DPP's office. Come on now. A bunch of nonsense. And I can assure you that they would do a much better job. Morning, Lisa. Julia says, class time. Thank you so much, everybody. Garcia Rosie says, I'm very disappointed with the DPP too. Aisle 2025 says, this is why the public has no faith in the RCIPS. Rumelia says, how do they determine it's inconsiderate driving? Well, I guess I'm assuming they have some dash cam footage and they're taking Larry's word for it about how this young man kind of pulled in. I mean, the thing about it, right? When you are driving, even on the East-West Arterial and all these places, sometimes you have a very slight couple seconds to merge. And I suspect, this is where now dash cam footage can be very, very instrumental. I suspect that asshole Larry was one of those drivers who could have paused a little bit and allow Christopher to merge in ahead of him. But you see, a lot of people, and that would be inconsiderate driving if Larry did this, a lot of people squeeze you out. Like they don't want you to merge, knowing that either you're going to stop completely and then start to back up traffic behind you, or they can pause a little bit, slightly brake, and allow you to come in. Their refusal to let you merge is, in my humble opinion, inconsiderate driving as well. Now, just because he didn't respond to it, maybe he did, and maybe this is where the defense needs to be thinking. His response was to push his way in. So it's actually Larry who's the inconsiderate asshole driver, and young Christopher trying to squeeze his way in. And so as a result of that, then a domino effect happened. Danny?
Yeah. When you are inside of your car on the road, even though your car is in a public place, inside of your car is private property.
Yes, and Mary mentioned this. I'm just trying to find the comment again, where she basically said, why was he not charged with trespassing? Because he literally was pulling, he was literally pulling Christopher's door open.
Yeah, and what does that tell you about his mens rea? That he would get out of his car, charge over, and push himself, part of himself, inside of his car to attack him. What does that tell you? But think about the reason why he's doing it, as Johan emphasized. If this is inconsiderate driving and that is how you're behaving, that's crazy.
Yeah, I mean, it's overkill for sure.
Yeah, because like when you're on the road, you need to be courteous to other drivers, and like you just rightly said, someone who is refusing to let somebody in, well, that's in my view inconsiderate. And I do it all the time where I'm very generous to people on the road because I understand that the traffic needs to flow in all directions in order for it to work. So, you can't take a view that, I have this right And if you don't respect my right, I am going to get out of the car and I'm going to beat you up. Would they? Do you understand what chaos we'd be living in if that was the standard?
Yes, it's ridiculous.
Anyhow, later.
Thank you so much. Yeah, so I had another birthday twin just message me, sharing a lot of birthdays of people today. Yeah, so I mean, that's a good point that Mary made, which is, listen, you know, at the end of the day, he was actually doing other things that are criminal offenses that he should be charged with. So only God knows why he wasn't charged with those. Now, there is a theory in criminal law that you don't I forget the exact term that they use, but you don't overly stack offenses. So say, for example, someone is involved in, I don't know, an offense, and the highest thing that they did was murder someone, but they also, you know, breaking and entering, they did a whole slew of other minor offenses. There is a theory and practice in law that you do not charge them with every little minute thing that led up to the big thing. So you go after the big charge. So if the big charge is manslaughter or murder, you go after that as opposed to all of these smaller offenses, because then they'll have like 20 offenses. And in the end, it's not going to make a difference in what they're convicted with if you catch them on the big thing. So I forget, I'm explaining it the best I can kind of on the fly this morning, but there is a certain logic to that in terms of, you know, how that works. So I'm imagining that that's probably why. So technically, yes, he may have committed these other offenses, but he's not going to get any more for trespassing offense in terms of the actual outcome than you would for common assault. So in other words, they take the worst of the offenses and they lead with that. And, you know, they might have a couple of them, but I've sat in court before and I've seen judges and magistrates say that, listen, all these other offenses that you put on here, you're just padding the case. And we don't need you to pad the case. We need you to come with, if you think it's manslaughter, if you think it's murder, you come with that and you build your case around that and you do it properly. So that could be an explanation as to why he was in charge with, you know, the trespassing one. Carlene, Elizabeth Evans says, I sure hope that they're prepared to charge everyone who's driving inconsiderate. People, get your dash cams ready and make the reports. If they don't charge them, then we know it's them trying to please Larry. But remember what I said now, there is two things to it. It has to get a reaction out of the other person, which is kind of interesting. So, you know, if you're out there inconsiderately driving, but people don't mind, they're like, oh, whatever. Or they just flip you off like the average person would do. The average person can just show you the bird and be like, oh, fuck you, and just keep driving, right? The average person does not get out there and act like Larry the fool. And so, but because it elicited this response from Larry, it's almost like this is then being used as a defense for Larry's behavior. And that's where I have a real concern. So this person says, good morning. Larry and Linda both need a good old pop head. Caymanians, boy, love the lingo. Linda needs somebody to ram down her. Y'all can read it. That young man should have given him 2 black and blue eyes. And I'm so sorry Larry met up with such a timid Caymanian. He needed one that would run his ass over with his car, assault, because they believe asshole Larry. Now talking about the DPP and the police. Yeah, I mean, you know, he did buck up on, I mean, this young man, he went them Caymanians with some good manners still. But I can tell you that there's a lot of Caymanian children, even at the age of 17, that would not have responded in this way. But perhaps it is for the best, because then we'd have another Caymanian child whose life is going to be ruined because he gave Larry and Linda, as you say, a proper pop head and boxed them both down. And then they'd be trying to send him down the river to northward for the next 25 years. So in all things, the silver lining is perhaps restraint was the best approach. Caller?
Yeah, I agree. Restraint was the best approach. I have a question for an inquiring mind. if everybody else is not jumping out of their car and behaving in that way, would the judge look at that and say, well, Larry is overreacting?
It's a possibility. It is definitely a possibility. So, it will come down now to evidence and testimony and all this kind of stuff. And hopefully, the magistrate who gets this will have enough sense to see exactly what transpired here.
Yeah, well, yeah, we'll see. But, there's one thing that really worries me, and that is, depending on how this case plays out, the young man may still have this arrest record that'll follow him for the rest of his life, and that just rubs me the wrong way.
I agree.
Take care.
This person said it's called the principle of proportionality. Thank you so much. Law school, been a minute, honey chill. We're going after the biggest charge is in the public interest. Also, law enforcement must use prosecutors' discretion. Yeah. Thank you so much for the birthday greetings. More of them coming in. This is an interesting one. Carlene says, I hope that he has a good lawyer and gets the charges dropped and then sues the RCIPS. Well, they're not going to drop the charges. I mean, they file the charges. So I, of all people, know that even when they know that they're not going to win a case, when everything is stacked against them, they will take a case all the way to the court and make the court make the decision as opposed to them conceding. I have been there, Elizabeth. I have shown them the smoking gun. Like, here's this email that proves I'm absolutely right with the nation building case, and those bitches still refuse to drop it. I have been there where even the judge, right? Judge, what his name was again? In my judicial review, Judge, oh, Lord have mercy. Henderson said to them, are you sure? This is a civil thing, it was a judicial review. But he said, are you sure that you have a case to answer to? You sure you don't want to go away and reconsider this? And they went from, I think he told them that like maybe November, whatever. They went from these November to May, right? Still showed up to court, arguing some bullshit in front of the judge. And he was like, then when I started, poor amateur me, representing myself, and I started answering questions, the judge was like, lawyer, are you sure this line of questioning is actually helping your case? But my client said, he said, who's your client? Oh, the police, the RCIPS. And this is what the judge said to her at the time. So your client, the RCIPS, knows more about the law than you, the lawyer? The dog is wagging the tail. You have the RCIPS tell you what the perimeters of the law are? Didn't I tell you guys from last year to consider if you really had a case? Then they had to throw in the towel. So Carlene, they don't just drop things just because they know they got it wrong, you know. In fact, I'm of the opinion that that's when they dig in even more. When they know they're wrong, they dig in even more because they feel like they have a point to make. Good morning, caller.
Morning, Sandra. Happy birthday.
Hey, morning. How are you? Thank you so much.
Wonderful. Hope you live to see 100 more of them.
Oh, gosh.
Torture people that doing shit in this country.
Yep.
Anyways, I kind of tore into Larry and Linda on my show Tuesday. And since that, I got a message someone sent me from, I think it's the U.S. Virgin Islands where they were at one point, and they were actually kicked out of there. Because of the similar situation with them harassing people and pretending like, that they had all this money and they ain't got no money. I can tell you what they told me. They said they don't have any money. They got friends and a whole pile of people to tell them. They tell them they're doing all of this stuff and they're going to give them this return on their loans that they get. And that's how they seem to look like they got money.
Yeah.
I'm just waiting for the person to send me that information on they were being kicked out of those islands, either the U.S. or the British Virgin Islands. But what I have a problem with is when you're going to get out of your car and do that to a minor, you should have, when the police arrived, they should have had some kind of drug testing kit to test the two of them, because
Yeah, they seem like they want
acted
something.
very, very much like they were under influence of a very hard drugs. And you know, I mean, come on.
Yeah.
Why would you be that angry at a young person?
Yeah.
But that hate that we got endure in this country from some of these people that come here and now he want PR. Well, you send me that petition, I'll fucking sign it a million times.
Yeah, well, we all got
These are
signed
the
it.
ones we need to kick out. They need to leave. Not they weren't indicted here by any of us. That's for sure.
That's for sure. Yeah.
Get out.
No, I agree.
Dusty,
Thank you so much.
For another 100 years.
I
God
appreciate
bless
it.
you.
Thank you so much.
You're welcome.
Yes, I mean it is an unbelievable situation. It's the tail that's wagging the dog. Thank you. I said the dog wagging the tail. The dog should be wagging the tail, but that's not what happening here. So yes, the tail is definitely wagging the dog. And you know, I'm ashamed to say that the DPP's office, and not to take any credit away from them, because you know they have a lot of cases and they do get convictions and they do a lot right, just like the police. I'm gonna give credit where credit is due, but a lot of times they also get it wrong, and they're getting it wrong too much, in my opinion. That really makes people lose faith in them. And they are, you know, offshoots of government departments, agencies, or whatever. That you don't want to lose faith in the police. You don't want to lose faith in DPP's office, because the courts, this is the very foundation upon which a proper democracy is built. When we start to lose faith in those types of agencies, my God, what next? But they're not doing themselves no favors. Somebody says, Sandy, the inconsiderate driving charge is a joke. If they stood out on Shamrock Road for 2 hours, they'd have hundreds of people charged with that. Police can't admit that they were wrong, just like Denny said. Yep. I think we read this one already. Yeah. So, you know, now here is what we need to do, Caymanians. Listen carefully. This will go through the court system. And again, this should not be some long protracted thing. I'm sure that they've got a good defense lawyer that hopefully can get this young man off of these charges. The court is going to do their thing. We're going to monitor this throughout the entire process. We will certainly advise you guys of we have to advise you guys of exactly, you know, how this progresses, what we can do. There's certain things that we can do and there's certain things that we cannot do. We can't, it's now in the matter of the court's hands, right? We will follow it through. We'll see what happens. We'll certainly be reporting what happens. We can't interfere with the judiciary in any way, shape, or form. Let me be very, very clear about that. So we will let the steps, right? What we can do is we can certainly do our part with the petition, letting the WORC, aka immigration, know that we don't want the likes of Larry and Linda here. We've got to start speaking out about undesirable people in our community. You can't come into a small place like Cayman, a small country like Cayman, and act the fool and demonstrate the type of person that you are, for us to then sit back and go, oh, we're not going to speak up about this. We're not going to say anything. No. We're going to start, because it look like we haven't been doing it before. We're going to start now putting a little something together. So here, listen to me carefully. I have some messages already about Larry, how he be acting in Northside, whatever. If you live in the district of Northside and you have messaged me before, because I do get 1,000,001 messages, I need you to message me again. Give me specifics about the assholery that what his name is, Larry and Linda be engaging in. Specific examples so that we can put that in our petition. We're not going to just say, oh, we just don't want these people here. No, we're going to make reference to the road rage incident. We're going to talk about how they are the neighbors that nobody wants in Northside. I have a message about how he's treating his workers. So I'm going to share all those details in there. We have to layer it, right? So that WORC can see this isn't just one incident. This is a guy who's not deserving of the ability to be able to stay in this country. Take your backside somewhere else. Somebody else might want you. We suggest Jamaica because we know they're going to deal with you over there. They don't want you either, but you'll get a different kind of justice over there. Ride up on somebody in Jamaica and try this shit with a 17-year-old. You'd be in a body bag within 24 hours. Them Jamaicans not going to play with you. Trust me, if you made it to 24 hours. We're not about that. Caymanians, y'all soft. And sometimes there's nothing wrong with being a little bit soft. Where we're going to step up, though, is the legal things that we can do, the protesting, the petitions, the vocalization of how we feel in this country. We are sick and tired of this foolishness, and we're not going to take it anymore. We're going to speak up. Those are the ways in which we will allow our voices to be heard. Never violence, because unfortunately, that is, you never come back from that. There's no returning from that, okay? And we want to be a good law-abiding community. All right, so I'm going to get the petition going. And then we are going to get on their asses. Thank you so much for all the amazing birthday greetings. Good morning, caller.
Well, good morning.
Hello, ma'am. How are you?
I'm good. I think happy birthday is in order.
Yes, thank you so much.
Well, happy birthday. And,
I appreciate it.
And I'm happy that your surgery process went well, obviously.
Yes, thank you, thank you.
Okay. And I hear that you're talking about the Larry and the Linda.
Uh-huh.
Okay. Well, I was just in another conversation, and I said, and I will say this openly, this to me is just another case of splitting the baby. Okay? So I appeal to all of my fellow Caymanians. If you still have your banners, get them rated, dust them off. And for those of you who haven't made any, please start making them, because this is another protest. And this time, we don't want a few people. We want all of you there. Okay? This has to stop.
Yep.
I'm sick and tired of this nonsense, of the advantage that is being taken of our Caymanians. Of course, this leads to somewhere else. I'm not sure I want to go there just yet. But the unfairness, the bias, the insulting, the humiliation, and, you know, in plain English, they're telling us we are lesser than.
Yep.
Well, guess what? I am not lesser than anyone.
That's right.
Because if you sold me for what I am worth, no one would have to work. Okay? So I want every Caymanian to think of themselves with that same value. Money does not make you rich. Just remember that.
That's right.
Doesn't make you rich. Doesn't make you anyone. It can't buy you class. I think that's obvious. Those people are not welcome here, and we should not, when they slip through the cracks, we should not entertain them. We cannot go anywhere and behave like this. None of us. Whether we're from Cayman, Jamaica, or anywhere else in the Caribbean, we will be dealt with accordingly. So we need to stand up and demand that this is what we want here. They imprison our Caymanians. They deny them bail. They're a flight risk. Where the hell are they going? But yet the foreigners can come in here. They don't even have to ask for bail. They're just let out to come back to have a kiss on the wrist.
Yes.
Is that fair? No, I don't think so.
Nope.
So we, the Caymanian people, we have to stop it. And I would appeal to everyone who went out on April 30th and voted. You go to your representative and you tell them you want changes made. And please do not forget to remind them it is time for that constitution to be overhauled, and now a proper constitution needs to be put in place. That is what should have been worked on. That is what the referendum should have been about.
Thank you.
Thank you, my darling.
Yes, thank you so much, Miss Brenda. I mean, we got a lot of cleaning up to do around here, and we might as well get started. That's all I can tell you, because it's a mess. It really, really is a mess. So this, you know, just very, very disappointed. Like I said last year when I saw this, my blood was boiling. I was like, what the hell? Are these people serious? And the timing, like I said, there was no irony in the timing that literally the day and the Wednesday, I was like, come on now, y'all need to get it together. And by Thursday, they come with these trumped up charges. Lord Jesus, they got to do better. Ridiculous. Anyway, we're going to keep on top of it. Like I said, petition's coming. Give me a little bit of time to work on it today. I do have another, a slew of things I'm working on, but I'm taking my time a little bit because, I'm still not 100%. And that, sometimes I feel a little bit tired during the day. So I am working on a few things in terms of that. Yeah. So I take my little breaks now during the day. And I got to get up and move and that sort of thing. But we'll have the petition done in the next couple of days. Let me see here now. The other thing I wanted to say is, let me just have a quick look. Yes, the other thing that I wanted to say, folks, is let me talk about Miss K-Man situation very, very briefly, because I thought we beat this horse to death last week. But clearly it requires some more beating. And I just want to dispense with it today so we don't have to talk about this anymore. The young lady, what's her name? Tonya Miller? Was that her name? Tonya Miller, whatever her name is. Forgive me for not fully remembering. I know it begins with T. Tonya, I think. Tonia or something. She came on the show last week and it was an interesting show. She flipped the switch on us. She went from crying on the one hand to like the very next second, the tears just dried up. And I am very, everybody responds a little bit differently in life to stuff. So I'm not trying to judge. We're trying to live more in a no judgment zone, but listen, Auntie's going to tell you she needs help. Something not quite firing 100. Okay? So she requires help, and there is no shame in saying and understanding that you need help. It's okay. Don't make anybody shame you into, you said I need therapy. What? So what? If you need therapy, girl, get therapy. What I do know is she said she wants to just be left alone. That's what she said. I just want to be left alone. You cannot be left alone. Let me make it very, very clear. In the world that we now live in, you cannot be left alone when you yourself refuse to leave a situation alone. If you say, I just want to be left alone, you were in the spotlight for 5 minutes. Now you're trying to extend it to 15 minutes, 20 minutes. But if you say to us in all sincerity that you want to be left alone, then you have got to stop. And this is where our young people, we're doing them a disservice in life by cushioning them a little bit too much. Okay? This is where now your mama got to step up to the plate and say, listen, honey, get over this. This is done. It's dusted. We move forward onto bigger and better things and just leave this alone. What is not for you, not for you? Some of y'all say, oh God, not gonna withhold what's not for you. Okay, if you believe it that, then this title was not for you. Leave it the hell alone. But the fact that she is obsessed, and I'm going to use that word, not in a clinical sense, but in a run-of-the-mill, everyday sense, the fact that she is obsessed with this whole thing is very, very concerning to me. You're doing the most, and quite frankly, you're doing too much. And so when you do too much, girl, people are not going to stop talking about you. So explain this one to me. Okay? I received this a couple times over the weekend. On her Instagram, she has Miss Universe Cayman Islands 2025. People are like, did she win the contest? Like, what the fuck? Clearly not. She didn't win the contest. I don't know if this means, like, did she update this because she was a contestant? Like, you don't update your status saying Miss Universe 2025. Like, I actually heard the committee's contemplating messaging her to say, please take this down, because you're giving people the impression that you are Miss Universe Cayman Islands 2025. Girl, you're a public figure. No, you're not. You're not a public figure. You have got to stop this shit, and you got to stop it now. Okay? Listen to someone who's a little bit older than you, girl. You are doing more harm to yourself and your own mental health by posting and going on and on about this foolishness. And there are people who are saying, thank God you didn't win that fucking title. Because what a hot mess. We thought Miss Universe was bad before, with one who was engaged in violence and all kind of stuff. They're like, shit, what would we be in for this time? Despite you being a beautiful enough young lady in your own right, yes, you're overweight. Okay? But here you are, you're continuing with it. You're posting all this stuff, which shows you have extremely low self-esteem. I know now that I am not beautiful on the outside. Shut the fuck up. Shut up. Stop it. Okay? This is where now you start to get on Auntie's nerves. I showed a lot of patience with you the other day, but now my patience has run dry. Now I have to come a little bit harder and a little bit colder. Stop this nonsense. All right? If you feel you're not beautiful on the outside, why the hell are you getting involved in a pageant where that is exactly what they're going to be judging you on? Outside beauty. Huh? Then she goes on to pat herself in the back. Good for her. But inside, I could carry so much care and love for people. Also, no Photoshop, because I want to be true to who I am. Girl, stop it. Stop it. Stop it. This is where somebody needs to take away the phone. They got to take away the iPad. Whatever the hell she is doing all this on, take her devices away. She needs to come off of social media for a good month. You need to detox from social media. Okay? What I learned from Miss Universe is that real beauty is on the outside. Girl, stop it. It's a fucking beauty competition. What do you think? You think you can win an ugly competition and be Miss Universe? No. Outside matters when you're up in a friggin' pageant. I can't even read the rest of this because this smacks of gaslighting, of narcissism, of just so many different things that you need to get a hold of. You're looking sympathy and you're not gaining sympathy, girl, because everybody now is out in the streets talking about you have mental health issues and you are batshit crazy. Huh? If you want to be left alone, sometimes you need to back the hell up and realize that you're a large part of your own problems and stop contributing to the problem. Girl, people are saying, oh, you know, she want to be a title holder. She want to be Miss Cayman, da-da-da-da. And yet the day after the pageant, you walk in the streets of Cayman eating a fucking patty. Literally eating a patty. Hello. Bag. This is Caymanian for you. Patty and a bag. The only thing missing is the Pepsi. That might have been in the handbag. Ease up on yourself. You have got to learn when to just walk away. You're lost. There could only be one winner. Walk away. You know, the truth is you never had a chance in hell of actually winning the pageant. And I don't know why nobody told you that. This is why I'm saying now, these pageants, I think, need to start telling people. Do not enter this pageant as a pet project and that you have to fix stuff during the pageant. If you got to lose 50 pounds by pageant day and you enter the pageant, that's a waste of your time. Not even Ozempic can be able to help you, girl. This is what I'm saying now. You're making people, even Isle says her posts over the weekend were bizarre. Like, move on. You're not doing yourself any favors. I want to help you. And the only way I can help you right now is to give you a dose of the cold, hard truth, young lady. Tiona, stop it. Stop posting. Shut down social media for a minute. This is where social media is not always good for our mental state. You are young. You can't handle no stress, apparently. You're not making yourself look good. And everybody's now judging you. You put a chocolate thing in your mouth, they're going to be judging you. You're eating a pat in a bag, they're going to be judging you. Every single comment you make, the things that people are saying, they're messaging me about you, you have got to stop it. People are saying, oh, she's definitely crazy. Huh? You talking about you were the backbone of this pageant? The backbone of which fucking pageant? There's a level of delusionality. I don't even know if that's a real word, but you were not the backbone of no pageant. And every single person who's liking your post, 92 people like that about you being the backbone. Stop encouraging this young lady. The way you stop encouraging her is don't like her posts. Because y'all are encouraging the insanity. And it's not going to do her any good. Good morning, Carla. Caller, sorry.
Sandra, I'm sorry to call you back, but I just want to say something. And I say this as a person that has served on the Miss Cayman committee, Miss Cayman World / Universe committee. To all the young ladies out there, as I said before, who are thinking to enter this contest, they do it for different reasons. I have had young ladies who came and entered. They were already prepared to lose. However, you know what they said? I just want to do this because I'm lacking here, I'm lacking there. And I think that being around other beautiful ladies, being around other women would, help me in that area. Some of them walked away saying how much they had gained, even though they didn't win. Okay? And I'll say this again. You first need to understand what the requirements are. And if you can't be honest with yourself or you don't know, talk to someone. This is not for everyone. And if you are going to enter it, to quote someone, you have to be prepared that you're running to lose. There are other girls that have lost. We have not seen this reaction. I don't know who is encouraging this young woman to do these things. If it is someone, I would appeal to that person. Stop it. If it's a young woman doing it on her own, and I say this as a mother, sweetheart, do not do it. Do not do it. I suggested, I think it was last week, that you put away your devices, take some time out, do not look at social media, just whatever amount of time you need, take that time to deal with this. In your life, you are going to be in many situations where you may not win or you may not come first. Don't take that to heart. Just examine the whole thing and perhaps you will gain from it. I went through my life not always winning, but it didn't make me a weaker person. It made me very strong. And I am always proud to say all of the stuff that I dealt with in my life made me the woman I am today. I continue to grow. I continue to learn. And guess what? Nobody can touch me. Okay?
Right.
That's how I feel about me.
Yeah.
Sandra could get on her show and have an entire show about me. Guess what? I will sit and listen and I will laugh. And I may call her and interact with her, but I am not going to go star crazy. I can promise you that.
Exactly.
And unless she starts to slander about mine and her bedroom affairs, I won't do her either. Okay? So, but on a serious note, I don't know this young lady. I don't know her family, but I imagine she does have family. And I saw some other people making positive comments on her behalf.
Yeah, people are trying to encourage her, but they're encouraging the delusion, unfortunately.
Yeah, but at this point, I would say to those people, please go and visit her, sit down, have a good conversation with her, and encourage her to now do the right thing.
Yeah, stay off of social media.
You are now entering into an arena that could destroy your life in every other capacity. Do not do that to yourself.
Exactly. And it seems like she doesn't have any self-control, Miss Brenda. This is very, very concerning. Somebody said, imagine if she don't get a promotion at work, how's she gonna be going on?
Well, and that is exactly my point. It could hamper her for the rest of her life in every sphere of her life.
Yeah.
And we don't want to see that happen to her. Sandra, I have said this many times, and I did it for years. I've dealt with so many young ladies. And I must tell you that none of them, whatever they felt personally, it never went public. And I only remember dealing with one who had the worst attitude. She did play, but because she didn't win, her attitude was so stink and nasty. It caused me to have to raise the point that she had to make changes in the contract. Because she even went so far as to refuse to carry out her duties as a runner-up. Yes, but she didn't go public.
Wow.
See, we knew about it, but the public didn't know.
Yes. And I must say, Miss Brenda, there's a lot of stuff that happens behind the scenes with these pageants that people would be surprised to know about.
Exactly. And I don't know who the committee members are. I don't care to know who they are. But I am also going to say, and I speak from experience, perhaps they might want to relook who the members are.
They got to start doing some things differently. Thank you, Miss Brenda.
Okay.
I appreciate it. No, this is a mess. I mean, somebody said here, can we not have one pageant? Hold on. This person says she needs to take some meds and go to sleep. She's living off of the attention, the cold hard truth. Another person says, is it too much to ask for Cayman to have a pageant without embarrassment and drama and scandal? Time to shut it down. You're not ready. I mean, it's just like every single year. And listen, there was other stuff that people sent me in relation to this pageant that I have not addressed because I was like, I'm not getting into this shit again. Government, my biggest thing with the whole Tiffany fiasco and whatever, that was government money. Don't waste government money and not ask for accountability. The board, the chair people and all the people, they need to be held accountable. Once government got rid of the pageant, I care very little, except y'all in the community sending me all this stuff all the time. Oh, Miss Sandy, look at this, look at that. I am so sick and tired of the fucking shit with this young lady now. Like I said, other people, oh, this one's being a mean girl. I'm like, there's only 4 of you. How the hell y'all can be mean girls with only 4? That's why I don't have no use in my head for pageants. This one said she needs help bad. She said Jesus doesn't want her to get her driver's license. Well, think the same way. Jesus didn't want you to get, the Miss Universe Cayman Islands because we'd be a hell of a mess. At first I was like, what the hell is MUCI? I got it. Lord Jesus. Really? I mean, you're 25 and you can't drive because you said Jesus don't want you driving. Well, Jesus said this wasn't for you either. Just accept it and move on. And the fact that she can't, I think, is in and of itself extremely telling. So then she went on to say that it streams to be the backbone of an entire competition, yet received the least applause and no award. How do you come to the conclusion in your head that you are the backbone of this entire competition? How were you the backbone? I mean, she said it the other day, like, if they didn't have 4 girls, there wouldn't have been a pageant. That is pure foolishness. That is ridiculousness. Stop talking shit. There's only so much foolishness that Auntie can take before she gonna flip, And this is just putting me on the other side of ridiculousness this morning. Good morning, Carla.
Good morning, Sandra.
You ever heard so much? Thank you, my darling. You ever heard so much nonsense in your life?
Let me weigh in on this nonsense. Let me tell you what these 2 women that have these pageants are doing, I'm gonna tell you, I went to school with one of them, okay? One went overseas and participated. That was Pamela Small. Sarah Lee or Dakers or whatever she goes by didn't get nothing.
Oh, was she actually in a pageant?
I think Dara went into Miss Cayman 2 years
here. Okay.
But she didn't win.
Okay.
Okay? I tell you the year. The one other classmate came down from the bride. Her name was Miss Tina Dilbert. She won Miss Teen Cayman Island. It all goes back from this foolishness. Dara needs to come out of the pageant world, and so does Pamela. Because the pageants that used to be Miss Cayman years ago, when the Cayman Islands government actually gave a scholarship, they still do. But when the likes of Miss Celeste Broderick used to have Miss Cayman Island, this type of madness did not go on. I think I remember one year way back when they didn't like the winner and they burnt the brand new car up.
Lord Jesus.
It was one year here that they did that.
My God.
But when Miss Celeste had this, we didn't carry on like this. Nobody went on with this foolishness. I was a big supporter of beauty pageants here because I had a lot of friends that went into them, okay? But this foolishness now, how these two chairpersons, whatever they want to call themselves for these pageants are. Look at when Dara gets up. She gets up and thinks that she's better than the Miss Cayman universe. Look at it. Look at how she dresses. You're still trying to be a beauty queen. Come off of it. You and Pamela need to come off of it and come out of these beauty queens. It is a pile of foolishness. Because in it 2 years straight that we've had nothing but controversies with both of these pageants.
I'm sick and tired of them.
And dethroning. Government needs to spend the money where the money needs to be spent. But it's not on 4 women parading up, down, one little stage. You can only muster 4 young women. Look at, let me tell you the truth of what that is saying, okay? If you can only muster 4 young women for a pageant, Sandra.
Lord
with
Jesus.
all of the beautiful Caymanian and intelligent young women we have around here, does that not tell you and the general public something? These young ladies are not interested in going into this foolishness.
I agree.
Because part of it is because of the 2 chairpersons or directors or whatever they want to call themselves. Because if my mouth would open, I would tell you one of them got a fake monkey. Okay?
Well, that's not the only thing, but yeah, it's all right.
One got a fake monkey, I'll tell you that.
Yeah. Fake monkey, fake
I mean,
boobs, everything they've done.
About
liposuction, injections, all that thing.
You get these young women, and then you're going to parade them on stage, and one isn't the beauty that you needed to be, but you put her in there to make the numbers.
She should have never been able to enter. She should have never been able to enter.
No, all you have done to this young lady is make us see the real young lady, if that is what she is. And you've broken her down.
But unfortunately, let me say this. I think she was already broken.
What I got to tell to Darren that I went to school. You have broken this young lady.
But hold on now. Let's be fair. She was already broken beforehand. Because nobody could not have gone in there not broken. Well, yeah.
Common sense.
Somebody said maybe.
That tells you clearly about the chairperson, doesn't it?
Well, somebody said that maybe they need to start having criteria where they're asking for mental health certificates and stuff like that to even enter the pageant. I'm like, imagine what a mess.
What they need to do is government needs to look at it and say we're not giving no scholarship.
Well, they don't. Government gives the scholarship, but they don't really do much. But I'm agreeing with you that I think government, although they have given up the pageant title, I think they need to find the money and put good money into other things other than pageants. There's a lot of amazing.
There's other things here, like children being out of school during the summer. And their parents
send them off on etiquette training. Get them mental health. Because look, enough of them need it. Make that for free. Make that free. The money you're spending on a scholarship for a Miss Universe, who already has an education, by the way, the one that is there now is very intelligent.
So
she don't need it. Yeah, spend that $70,000 making mental health free for young people. That's what they better try and do.
or put in another like the likes of Alex Stanton Foundation.
Yes, put some money into that.
What you call it? Put some money into that and put another one in the Eastern District. Open another safe place for our teenagers.
Exactly.
So when they get out of school and they feel mentally stressed from going to school and they can go there and talk to a counselor.
Yeah.
You need to stop this foolishness of wasting the people's money. Because Jerry Lee Dakers is getting up and Pamela Small is getting up and going to all, you know what the two of them are doing? Going all over the world with these young ladies.
Mm-hmm.
They're traveling. Who wouldn't want that job every year? Every year I can go to a pageant somewhere else in the world.
Yeah.
No, these two chairpersons need to step down.
I think that
That's
people
what they need to do.
I think people are holding on to nostalgia, as you say, from when they either won it or barely won it or
young.
whatever.
You're no longer young.
Yeah.
Let the bottle out. Let it float and let it sink. Get off of it, Gary Dickersley, or whatever you go by in Pamela Small. Come out of it. Let some other young lady that is growing up in these times do the work and stay there and help train them.
Thank you, honey child.
People that read it in this came on 40 years ago.
Mm-hmm. And they also not commit all these years.
Why you still up there? Why the bunch of honest still up there giving up trophies?
And still putting the sash on.
Let the younger generation do the job
and
now.
Here the best part, putting the sash on wrong still after 40 years of being up on a friggin' stage. You can imagine. Leave me there, caller. Leave me there.
Pass the baton. But on another note, I'm glad that the prayers were answered and your surgery went well.
Thank you so much.
Enjoy your birthday.
I appreciate it.
And, you know, just thank you for bringing things that matter. Because I will say this, I watch Radio Cayman during the day, but Radio Cayman needs to do some serious changing in their lineup that they have because they don't get nobody watching. 10, 12, 20 people maybe win morning shows and afternoon shows. And Radio Cayman needs to it's the people's station, and Radio Cayman needs to let the Caymanian people speak and stop putting the news in front of the Caymanian people, because all you can hear Radio Cayman say is, we need to go to a break for the news. Is the news more important than discussing the problems of this country and the people? No, it's not. That's why I got to say to Radio Cayman. Have a good day, Sandra. Thank you for all you do.
I appreciate it. Thank you so much.
Bye-bye, my dear.
Someone say, if I got love him anymore. This person says, please give the caller kaboom. I love him bad. Oh my God. Somebody said before the fake bottom, she wore the panties that made her bottom look big. Lord Jesus, y'all. These people are trying to live vicariously through I don't know what. Anyway, this young lady claims that she was the backbone of the pageant because, yes, if it wasn't for her, they would not have had a pageant. That don't make you a fucking backbone. They would have proceeded with 3 or just postponed it till next year. Stop it, please. I'm begging you, young lady, for your own sanity and well-being. It's time for you to give up this ghost. It's just too much. You're not hashtag grace, hashtag pillar, hashtag strength. You're not operating with any of those things. You're doing yourself a real injustice. This person says, good morning. Happy birthday, old heart. Thank you. Hoping you had a wonderful pain-free day with lots of food and cake. Is this caller a short, heavy-set guy that worked at the bank? No. I know who you're confusing with him with, but it's not him. I really like him. He tells it like it is. Been trying to figure out who he is. No, they kind of do speak a little bit similar. But that's not who that is. Yeah. But anyway, honey child. Yeah, I'm sick and tired of talking about pageants. And I do think that some of these people who operate pageants are vicariously living through others. And I just can't take it anymore. It's just... we have more important things that we could really be focusing on when it comes to building up our young ladies. And given the drama that is surrounding these committees, it's just ridiculous. And listen, if y'all think that we hearing all of it, I can assure you that we don't. There's a lot of shit. Remember when Derry took over and she put what her name is again? Oh God. She used to live down Newlands for a long time. She dated Tommy E. Banks. What her name is again? Her daughter actually, I think, won 1 year. Catherine Tyson. She had actually put Catherine Tyson as the director or whatever. No, she's the director. And she put Catherine Tyson, I think, as a chair or something. All of a sudden, Catherine disappeared. You never heard nothing about that. You know why? More fucking drama again. I ain't not seen nothing with more drama in my life than these pageants. I'm sick and tired of it. They're really not worth the drama. Cut it out. It's stupid. Miss Brenda said there were pageants held with 3 contestants before. Exactly. I do not know why this young lady thinks she is so special. Girl, please give it up. We're sick and tired of hearing it now. Okay? It's been over a week. Just come off of social media. Damien says they're stuck in the 1980s. Good morning, Loretta. Thank you so much. Says happy birthday, Auntie. I appreciate it. Jesse, thank you for the birthday greetings. Miss Jewel Hyde's in the house. Thank you so much. She says, wishing you a great one. Lucille says, Sandy, it is only one person can win. I really remember when they had burned the car. It was a shame. It needs to stop. Jesus, they only need one beauty queen, and they pick up how they want. The lady is so right. It's just a bunch of nonsense. I obviously wasn't in Cayman, I think, when that happened. But Lord have mercy. Y'all need to do better. I'm tired of talking about it. I don't want to talk about pageants anymore. Like I said, we got more important things to be discussing in this country. Tiona, come off of social media. That's your best bet. Go eat that pat and just be happy, girl. Sometimes fluffy and fat girls just got to admit that you love to eat. Speaking of loving to eat, big shout out to my aunt, Adonia Barnes, aka Topsy. She made me a lovely cake for my birthday yesterday, lemon. I think this one is actually key lime. Normally she does a lemon and lemon, which I love, but this one got a key lime flavor, homemade. She makes everything from scratch, icing, everything. Thank you so much. That was delivered to me yesterday. So I got to enjoy a nice slice of that, and I really, really appreciated it. Now, I'm going to play a little video segment for you guys. I want you guys to sit back and watch. It is that time of year when children are going to be returning to school. So 'tis the season, as they say. And of course, parents, I know y'all stressed out. I had somebody call me last week complaining about that list again, the school supply list. Listen, just don't take it. What do they do to you if you don't take the school supply list? It's not like they're going to kick your kids out, right? I don't think so. But what I will say is that a lot of the MPs do get their communities together and they give out, school books and supplies to some of the children. So Morna says, I was Miss Cayman for 67 years and I still hold my title by birth. So I'm going to share a little interview on Wednesday evening. We got to stop by the Newlands and Savannah office and enjoy a little check-in on their event that they had. They made it like a family fun day back to school event where they gave out backpacks and stuff to the kids. So sit back and enjoy this. And before I go, don't remember CMR TV making some big, biggity waves around the place. By the way, Jim, I saw your comment. Jim said, where's Jim's comment? He said that word that I just made up. He said Wendy Williams used to use that. I was like, really? Huh. What was the word again? I can't remember, honey chill. Something I said. And I was like, I don't know if that's a real word. He said Wendy used to use it. Bless her little heart. Poor Wendy. She's going through a difficult time these days. What was the word again, Jim? Jim says we put things out in the universe such as social media. It's out there for all to see. The public has been given the rights to your business and express how they see it. Just give it up. Give it up already. Ugh. Delusionality is a word created by Miss Wendy Williams. Really? Well, there you go. Delusionality. Enough of y'all suffering from that. I'm just saying. Tomorrow's show, I want to address a comment I saw on social media about the Thompson boy, Robert Thompson Jr. And I need to bring y'all, was it assholery? No, but I'm sure somebody has oh, thank you, Paul. I got some Bermuda ginger beer I've been drinking post-surgery, and that was delicious. I think I might be finished now. I don't think I have any left, but thank you so much. Next time you come, Cayman, bring me some more. It's very, very nice. All right, here's a video about returning to school. Remind me tomorrow, I want to talk about the Thompson case. We got a little bit more details perhaps on that. I'd like to actually speak to the alleged complainant, a victim, and get her side of the story as well. But anywho, yeah, what another hot mess, child. There is never a dull moment in the Cayman Islands. But anywho, stay tuned for a few video notices, and I will see you guys tomorrow.
Big things are happening at CMR TV. We're excited to announce that Phase 2 of our expansion project officially launches on September 1st. With this next phase, we're welcoming new partners, new shows, and new opportunities for the Cayman community. From sports coverage to community events and the much anticipated relaunch of our youth program, there's something for everyone. If you're a middle or high school student who's interested in being part of our new youth show, we want to hear from you. Details and participation criteria will be released soon. But that's not all. We're calling on content creators across the Cayman Islands. If you have a show idea or want to share your voice, this is your chance. Reach out to us at info@cmrtv.com and become part of the growing CMR TV family. We're also excited to announce a brand new feature, the Cayman Music Hour. Each week, we'll spotlight local musicians across all genres, from reggae to soca, hip-hop to gospel. If you're a Caymanian musician and want your music featured on our platform, now is the time to submit. Please note, songs must be free of profanity. And we're not stopping there. Churches, religious organizations, and cultural groups, CMR TV is opening the doors for you too. Whether you want to share services, cultural programs, or community showcases, this is your platform. It's an exciting time at Cayman Marl Road as we continue to grow CMRTV.com into the ultimate destination for news, entertainment, culture, and community. So stay tuned because the best is yet to come.
Well, we're here at the Savannah Newlands MP office. And wow, looks like you guys have had a very, very successful back to school event. Heather, I see lots of kids. I have heard that literally hundreds of kids have come through here today.
It's been a busy afternoon, very busy, and it's been an awesome, awesome turnout. And we've done, I think it was almost 300 back to school bags. And the kids are all ready now to head back to school at the end of this month. So great turnout. Yes. We thank the parents for coming out and bringing them because every child deserves to have their backpacks all filled with supplies and ready for another great year.
Yes, absolutely. And I think it's so nice that the kids get to come to this event and see going back to school as something that is fun. Right? So you got the bouncing castle, you got fun music. I saw so many kids out there playing different games.
That was what interested me. I mean, like, I caught my attention that so many kids were out there playing every game we had.
Yeah.
We got food as far as hot dogs. We got pizza.
Oh yeah.
We got everything out there. Bouncing castle. The kids are really having a great time this evening.
Yeah, they had a fantastic time. So as kids are starting on their journey, what would you, what sort of advice would you give them as they're trying to focus for the new school year?
The advice I am going to give is, I'm going to start with the parents. Prepare your children. Make sure that your children are told that when they arrive at school, that they're ready to face a school year. Let the children know that they walk into the school in a respectable manner. It starts at home. The parents have to take that responsibility on and ensure that their children, when they're at school, that they treat the teachers and every other person that's working within the school grounds are treated with respect. So parents, just take all of this advice and ensure that your children are ready for school, because if they don't start it at home,
that sets the correct foundation.
It sets the foundation.
Yeah, absolutely.
And we're encouraging the parents to really, because this is a new school year, it's a new minister, and things are going to be changed. Things are changing. So we want to just put that word out there that it's going to be different.
Yeah, time to buckle up and get serious about your education.
Exactly.
Yeah.
And we love to see the children come out here and have a good time. I mean, we provide this little facility out here, and so many parents have been so like relaxed and just sitting down outside and in the nice cool. It's not such a cool evening, but I mean, at least it's beautiful afternoon, and they're having a good time and they're enjoying the food and all the entertainment. So we're happy to be able to do this.
And it's so good to see the community, because every time I come to one of the events here, they're familiar faces. You know, you get to see some of the same kids, but I saw a lot of new faces here today as well. So I'm glad that the kids really got to enjoy the event and got school supplies. Can you tell us what was in the bag so that we have an idea?
We started off with the composition books. Every child will get a composition, like 2 or 3 composition books. They got glue, they got pencils, they got pens, they got crayons, they got markers, they got rulers, they got scissors. Everything that's needed.
Essentials.
All the essential things that are needed for the new school year.
Fantastic.
And they got the nice little bags. You want to hold one of those bags up?
Yes, these bags are fantastic. And they come in different colors.
Yes. We got these nice little bags that they can carry on their back, and it's like
Newlands and Savannah community. Beautiful.
Newlands Savannah community.
Yeah.
So we're preparing them for everything. They can put these on their arms, or they can strap them around their back.
Yeah, wonderful.
And all the supplies are loaded in here. And if they want to use it as a bag to also put their uniforms in, or their sports uniforms in, they can use that as well.
Yeah, absolutely, wonderful.
So we appreciate the children and the parents coming in this evening, and we also had a good time too. I was out there playing games with the kids, and had a hot dog. It was all delicious.
Yeah.
Snow cones as well, and lemonade, and Swanky, I think we all also had it there.
Wonderful. Thank you so much, Heather. Really appreciate you always taking the time to keep our community, our CMR family for sure, and community up to date and what you guys have been doing.
Oh, we love our communities, and I think people realize that we take care of our people too, and that's the name of the game around here. We make sure that our people are looked after and taken care of, and this is a passion of ours. We enjoy it very much. So take care, and all the parents and the kids, send a big shout out to you guys when you go back to school, and take care, and be good kids. Make sure that you treat your teachers with respect, and go to school, dress properly, make sure that you're dressed for success. So
yeah, wonderful.
Shout out to all of those that are heading back to school at the end of the month.
Thank you so much. We appreciate it. Folks, that's MP Heather Bodden for the beautiful district of Savannah. So we've had the pleasure of speaking with MP Heather Bodden for Savannah. Now we're having the equal pleasure, I should say, of speaking with MP for Newlands, none other than Wayne Panton, who's also here this evening at the back to school event held at their community office. So Wayne, I've heard that you had well over 300 bags, I think in a range of 350, and at least that many children benefited from, this community event where they got to get some supplies, some much needed basic supplies. And of course, you were here to see them enjoy themselves and have such a fantastic time. So tell us a little bit about your impressions of this annual event here again for 2025.
Well, it's been another successful event. We had a lot of children come in with their parents or with some of their guardians, older sisters, aunties, grandmothers. It's been wonderful. And of course we had, snow cones and popcorns and bouncing castles and good music and all kinds of really good stuff for the kids to enjoy themselves. And they get their school supplies as well. So we have school supplies. This one is, for example, a high school version. And then we have another lighter color version that we use for the primary schools.
Nice.
And it has been wonderful. Turnout has been excellent, better than we probably anticipated. We had some nice little nibbles for them and cupcakes and pizza and all sorts of stuff. So they've been well taken care of, and they've all had a really good time. And it is a pleasure to always be able to do this, to help families, address the needs for the kids going back to school. And a lot of this stuff is quite expensive. So anything we can do to help, we're more than happy to be able to do that. So it's been a really good evening, well spent, and everyone has had a good time, including ourselves.
Yeah, fantastic. So, every year, I remember as a kid, the excitement around getting ready for school, and kids love getting, new supplies and new school uniforms and all that fun stuff. But it's really serious business going to school and trying to, get the best grades you can. So what sort of advice would you have, I would say, first for parents, and then maybe for our children as well as they head into a new school year?
Well, I think for parents, I would say be involved as much as you can with your children's schooling, with their activities. Stay in touch with the teachers. Understand whether there are any issues that your children may be having. I think your teachers are going to be people who are really interested in the best possible outcomes for the children, and staying connected, staying in contact, and understanding what may be going on, and or just that everything is really going well, and take advantage of the opportunity to, depending on the ages of your children, but stay engaged at home as well. Make sure that they're doing their homework, and if they're younger, read to them and spend time doing that. I think all of that is very positive for parents to be doing. From the children's perspective, I don't know, we were all young at one time, so we know these things. And there are times when you look back and you think, well, I would rather not have had my parents come along to some of these events and parent-teacher stuff and all that. But having your parents involved and for the children, respecting the need for them to be in school, to get a good education, I think that is going to be very positive for their ultimate development and their development in life and success in life. Education is never wasted at all. I know young people may feel that they don't see some of the value at times, but listen to your parents, follow their advice, and follow your teacher's advice, because they are going to lead you in the right path.
Fantastic. You talked about the significance and importance, really, of reading to your children. I was reading something recently that said, don't just tell your kids to go and sit down with a book and read themselves. Right. The real benefit is received when you actually sit down and you read to them.
Yeah.
So, committing just even 15 minutes a day to reading to your children is something that I think as parents that we could all probably improve upon and just make that a new goal for the new school year. And then there was another study that I found equally interesting, which actually said that fathers in particular, sitting down and reading with their kids and doing homework, showed an even more significant improvement in not just their academic performance, but their overall performance in life. So, dads, it's not just the moms, but everybody needs to step up to the plate and make obtaining a good education a family affair.
You're right. The family affair, I mean, it's a whole family exercise to ensure that kids get the best out of school. And it's something that is sometimes, a time commitment. And I know when parents are tired, as we can all be at the end of a day, we need to find that extra energy to just continue to invest that time in our children. And I think it pays huge dividends at the end of the day, both in terms of their development, their behavior, and their academic performance. That, I think that's invaluable as an investment.
Fantastic. Well, it's always a pleasure catching up with you. And I know that your community office has been extremely busy, so we'll be talking to you again soon about some other initiatives that you have had going on. But, this office is open. You offer incredible services. Ms. Heather was mentioning earlier that some parents were coming in with documentation that they may have needed her to sign. I think she's a JP. And, all of those services you can get right here at the Newlands office. So make sure you utilize the office, folks, as much as you can. And thanks again to MP for Newlands, Mr. Wayne Panton.
Thank you for joining us. And I'd like just to say thank you to all the parents and children who came out this evening and enjoyed themselves. It was a pleasure for us.
Thank you.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.